Good morning, everybody. This is June 7th, 2018, the meeting of the Marion County Budget Committee. We will come back to order. First item on our agenda is a public hearing. I noticed that there is no comment and we have nobody here to testify, so we will recess the public hearing and go into regular session to allow the health department to make their presentation and get back to work, because I know they're all busy today. So, Carrie, come on up. Good morning.
Good morning. Thank you for having us. Good morning, Chair Vance, Board of Commissioners, and the Budget Committee members. I'm Carrie Moeller, and I'm the Administrator for Health and Human Services. And with me, I have
Ryan Matthews, Administrative Services Division Director for Health and Human Services.
So we've had a busy year and a busy couple weeks, but for your reference, you all should have a handout, which is our reorganizational chart. So I'm not going to go over this directly in detail, but if you have questions, it's available to you, and it looks like this. Okay. So I would like to start first by recognizing the incredible contributions the employees of the Health and Human Services provide to this community. Excellent, high-quality, compassionate services. And I would also like to recognize the tremendous contribution for our executive leadership team. Most of you know Ryan. He's our highly valued, skilled administrative services director. Ryan's worked for the department for many years and has been instrumental in our budget process. Ryan has a keen finance mind and a great heart for this work. He understands our programs really well, and I value his contribution tremendously. Behind me, Pam Hutchinson, Sydney Nestor, and Scott Richards. Collectively, the executive team has served Marion County for more than 75 years. Pam is our Public Health Division Director. She has had a significant year with highly visible events, one of that we're currently in the middle of, our solar eclipse, our water quality, and modernizing our public health system. In collaboration with our emergency management partners and the community, Pam's team does a tremendous job here. It's with mixed emotion today that I tell you Pam's retiring. We've gotten our official notice. Her departure will definitely impact our program and me personally, and I wish her the very best in her retirement. Sydney.
Carrie, let me interrupt for just a second, because that is Pam and I have known and worked with each other for 25 years, I think, in various settings, and she will be hard for you to replace.
Yes,
anyway,
she will. Thank
I
you,
just had to make
Patrick.
that
No,
comment.
yeah, it's significant, and hopefully Pam's done a tremendous gift to me and given us a significant amount of notice, because we do recognize it's going to be very hard to fill that position. So Sydney Nestor is our Human Services Director. That program encompasses intellectual and developmental disabilities. It's where our evidence-based practices sit, our residential care coordination. Sydney offers exceptional clinical and program development experience. She's been instrumental in engaging our system of care partners and reminds us every day the vital role and importance of voice, individual voice, family voice, and staff voice, and their role they play in the healthcare provider system. And then Scott. Scott's our Behavioral Health Division Director. Scott's responsible for our whole outpatient services, both addictions and mental health services, as well as our crisis service. Under Scott's leadership, we continue to build our very important collaborative efforts with our public safety partners, the acute care system, and the state hospital. Scott's provides oversight to our prescribing services as well. And if you don't know how hard it is to retain and engage prescribers in this community, it's very, very difficult, and Scott has done a remarkable job at that. More regularly than I'd like, he's in my office to say, I think we're going to lose a prescriber, and he just digs in and very quietly and systematically ensures that we've got those high-quality services. And I'd also like to recognize the support of the board's office and other departments. You heard in the opening remarks from John the reorganization and the impact it's had, not only on our department, but the administrative and support services of the county, IT, finance, business services, even the treasurer's office got involved in that reorganization, and the staff of the health department. It was a very collaborative and full press effort, and it does what I had intended it to do, aligns our focus and our values in the department, and I really appreciate everybody's support on that. Okay, so today I am seeking approval for the Health and Human Services to budget. It's a total budget of $75,945,396, and this starts on page 350 of your book. This is the resource and requirements page. We have a budget and a full-time FTE of 455, the largest in the county. It represents four divisions and 15 program areas. Last year, fiscal year, the Health and Human Service Department served over 41,000 people and provided more than 450,000 encounters to the citizens of Marion County. So it's an overall increase of our budget of about 1.7%. So I'd just like to give you a little context for the work that we do this year going forward. Of significant importance, Oregon Health Authority, as directed by the Governor Brown, has launched a process to investigate and develop policy recommendations to improve our coordinated care organizations. Specifically in her directive, there have been 4 areas that she's asked the community and the Health Policy Board and OHA to consider. All of those 4 areas affect Health and Human Services directly, and those are specifically an intentional improvement in the behavioral health system that speaks to access, quality of care, and the integration of care. A focus on social determinants of health and equity. That's a phrase that's been circling around for a while. It's very intentional in this next effort, and it really looks at those other circumstances in our community for individuals that impact the health of the individual. So healthcare has historically looked at very specific things related to illness and recovery, and this really stretches us to start thinking about those other factors in people's lives that impact their life. They're moving to a pay-for-performance expectation. We had an early lead on that with the help of Commissioner Carlson around our what we call our APMs, alternative payment methodology, and that really was an early entree into ensuring that we get reimbursed and paid for quality care with good outcomes. And then finally, the 4th area of her directive is sustainable cost growth. So the Oregon Health Authority in early 2019 will be issuing a RFP with the new selection of coordinated care organizations in January of 2020. So that's going to have a significant impact on our department, but it also gives us the opportunity to influence and engage with our critical partners around what is called CCO 2.0. So that's what you'll be hearing. And it also gives us an opportunity to think about what's happening here in our department and how we're going to provide overall better health to our community. So we launched a strategic planning process early in the year with a group called Coraggio Group. I think maybe most of you have had the opportunity to interact with that strategic plan process, and I appreciate your input very much. So the strategic plan will set a framework for our future and longer-term goals, and will provide us the opportunity to provide critical services to our community. We'll be intentional with those services. We'll be able to respond to the needs of our funders and our staff. Oregon's continuous changing healthcare system, it represents a timely and critical opportunity for us to respond to the needs of the community. By assessing current environment, considering our future, establishing priorities, and the use of data to inform our decision-making. We're setting a unified, overarching direction for the department, and our intention is to develop a vision for our organization that helps us to be the best we can be, gives meaning and purpose to our work helps define our role in the community, respond with intention to better address the needs of the community and meet our funders' expectations, and more effectively create a workplace that our staff are proud to be a part of. The overarching goals for our strategic plan: this is a biggie. Launch the new electronic health record. Increase our consumer satisfaction and awareness of services. We heard through our focus groups how very little, in some areas, people knew, the community knew about the great services we're providing. So I'm being very intentional about our efforts to engage the community this next year. Improve our quality improvement capabilities and support our people, our staff, to promote their professional development and better engagement by all. So that's sort of the context for the work we've got ahead of us. And I'd like to turn your attention to page 352, please, Addictions Treatment Services. So this is a very critical program for us. I appreciate and have a great pride in all the services that we provide in our department. Right now, the medication-assisted treatment program is the area of treatment for folks who are struggling with opioid addiction. Oregon has one of the highest rates of prescription opioid misuse in the nation. And Marion County Addictions Treatment Services has seen an increase of more than 40% in the last year, primarily around access to services for opioid addiction. In March of 2018, we completed our first phase of what we refer to as our Silverton Road project, where we relocated our addiction treatment services from an industrial area across town to the Silverton Road building. What an market improvement in the quality of the facility that we're providing services in. And not only the high quality professional services, it's had a tremendous impact on the morale of staff and the engagement that we're seeing with our consumers of service. And it did some really important things. It got us out of an active floodplain zone. It created some space for us to provide these high quality services, and it's now on the local public transportation route. We had to carpool our individuals to and from that other building many times a day for years. So we're very, very pleased with that. We are launching phase 2 of Silverton Road with a goal of integrating care. Part of the work of the CCO in the behavioral health improvements is around integration of behavioral health care with primary care. And so we knew that was coming and are poised to make significant efforts this year in terms of our integration of care. So our intention is to create an adult campus where all of our adult outpatient services will be located in one building, so people who have substance use needs, treatment needs, who have mental health treatment needs, who have both. Many of our people struggle with maintaining sobriety and stabilizing their recovery, will be able to provide that service in one location. And we have created some capacity to build integrated health care there. So we're hoping to add primary care, a small primary care component to our adult outpatient services there. And through our addiction treatment services, we also have our lead staff. You've been hearing a lot about that. A lot of good work here from Commissioner Carlson and Deputy District Attorney Paige Clarkston, who led this high-powered project team. We've been very successful. The lead peer navigator is supported by our addictions treatment services. And before you, this budget committee, you also have a consideration for a decision package. The one thing I will point out in the budget, we did lose a significant resource this year in our addiction treatment services, so you'll see it under the intergovernmental state and local. We had a integrated multidisciplinary program. We refer to it as Woodmansey, and that was based on the location in town it was provided. It was a collaborative effort with DHS and Self-Sufficiency, our outpatient treatment programs, Catholic Community Services. It was a housing program where we provided on-site services, and that grant ended. So that's the significant change there. If you'll turn now to page 354, our Child and Youth Services. This year, you've been hearing from us about the addition of crisis services. We've added a child-specific crisis service. We relocated it outside of the PCC. We've seen some really positive gains here, and again, I want to give an acknowledgement to Commissioner Carlson, who leads our System of Care Executive Committee that launched a assessment of the needs of kids in our community. It included child welfare, juvenile justice, Salem Health, WVCH, BCN, Sydney as the involved in the Regional Partners Committee, and we developed this crisis service. It provides a wide variety of services to kids and families who are in crisis. Like I said, the early numbers are very positive. It started in September. We've doubled in terms of our contact with kids in this crisis service, so the growth has been exponential. We'll continue to evaluate the needs of kids in our community, and our Children's Behavioral Health Program also sits inside of this service, and we've this year topped enrollment of kids and families that we're serving of more than 1,500 in our Children's Behavioral Health Program. So the needs are great. I hear from John often, who reminds us about how important children's mental health is, and we'll continue to focus on this effort and do everything we can to be responsive to the needs of our community. And the other thing I wanted to highlight here in our crisis program and our kids program is we've centralized our intake service. So one of the things we heard from our community and early on in a review that we had a couple years ago was how difficult it is to access service. It's complicated, complex. We have many locations. So we, with Scott's leadership, have centralized our intake services for outpatient kids and adults. One number. People get screened there and get referred appropriately. We think it's a fabulous response, a much better response for our community. And then we've also added a new phone system, which allows us to track high peak areas, volume, times a day. It allows us to resolve our times more effectively, and then we'll be able to provide some good data out of that system to inform our planning in the future. Page 356. Adult services, 10% growth here in our adult outpatient services. Again, this was a response to a stated need by the BCN. We adjusted our admission criteria a little bit there and have been able to serve more people in this program. This program primarily serves folks with the highest, most complex needs in our community. We provide the outpatient and prescriber services here. See if there's anything else I want to add to that. I don't think so. Page 358 is our acute and forensic services program. This is a highly visible service in the department. Again, a program I'm very proud of. Here you see services like our jail mental health services, our 24-hour crisis service, evaluations through hospital, mobile crisis, and inpatient care. So this program I see as sort of the hub for our law enforcement, hospital, and crisis services. I was at a meeting, or Pat Allen, the director of OHA, was presenting, and he remarked on the incredible services we provide at PCC in our law enforcement collaboration. So we've been well recognized across the state for this program, and it doesn't happen on its own. We're very intentional about maintaining our collaborative relationships with our community partners, and I certainly believe that our community is stronger and safer when individuals with mental illness and substance abuse are connected to the community rather than are further involved in law enforcement when there's a mental health or substance abuse component that's driving some of that law enforcement contact. Noteworthy in this program, our crisis service is facing a much-needed and long-anticipated renovation at their current location. So the Crisis Center, PCC, is located on the campus of Salem Hospital. We've been there for many years, and with their intention and support, they'll be looking at renovating that program. It'll be great at the end, but it will have a significant impact on us in the interim. So we'll have a conversation with them and an ongoing question about where and how we'll provide services during the renovation. 360 is our intensive services and support program. This is a new program under the reorganization of Health and Human Services. It's a service that we've been providing in some capacity for a while, but we really wanted to give it some intention. So what we heard in the community conversation, there's a group of individuals who need supports getting to the other services that they need, medical appointments, other social services, and have had therapy or medication services, but really what they need is this care coordination and intensive supports to get to the other services in the community. So we've created this program to provide some of those services, and we're seeing we have had a soft rollout, and will be very intentional in terms of informing the community of that new service in our department. Health and Human Services also encompasses our developmental disabilities program, intellectual and developmental disabilities program. This was probably one of the primary drivers in my mind around the name change. So we've been providing high-quality medical services in this community for a long time, but there are certainly some services within the department that weren't necessarily health or medical related, that were really about supporting people. And the intellectual and developmental disabilities program was certainly one of those. It's stable this year, relatively stable from the funding perspective, which I'm happy to report. This has been a program that's had a lot of fluctuation, both in terms of expectations and funding. We, Marion County Health Department, Health and Human Services Department, along with other developmental disability programs, negotiated a new funding model with the state. So we got an increased encounter rate for the services that we provided, which helps to stabilize our budget. Let's see, the significant change on the 362 here is the administrative. There's a lot of administrative work that goes into our developmental disabilities program, and we have a subset of folks who we call DD admin, and they have historically sat inside of the developmental disabilities program. This last year we moved them under our administrative services program, and so that's the significant change you see there in the budget. Let me get caught up with myself here. Let's see, I hope I didn't miss one. Yep. Yeah, 364, sorry. I wanted to pay a bit of attention to this one. It takes me back to my comments around social determinants of health. So we've provided residential services in our department for a long time. The change you see here is because of the reorganization of our department. It's a hallmark for our program, and very few resources, in my opinion, take on such a significant role in the overall health of individuals as housing. We recognize the connection between housing, work, poverty, violence on the overall health of our individuals, and giving attention and resource to the social factors. It will be the central work of our department this next year, and as I said earlier, it's primary focus of the coordinated care organization. So our housing services and supports had a growth this year. We've been very intentional, and is central to our strategic planning efforts. So we offer a wide array of residential services, from folks who are coming out of the hospital to who are experiencing homelessness or returning from other institutions like incarceration. And we provide individual, group home, and supported living opportunities for people. The success of this program, I think, is specifically rooted in the positive relationships we have in this community. So the staff in this program have worked very hard to establish very positive relationships with landlords and with our housing authorities and other social service supports. So we find ourselves in this really delightful place where we actually have landlords seeking us out when they have vacancies because of the good work that our staff provide to ensure people are successful in their housing. We also have resources to reduce barriers. People who have had chronic homelessness or other problems with housing often need support to sort of clean up their histories, pay back utilities, back utility bills and things like that. And it's the support that we can provide to individuals that have helped us to be very, very successful. Under Sydney's leadership here, we've developed this year almost double the capacity in our supported housing program. We have 73 beds now at 16 sites, and so that's actual facilities or residential apartments that we actually have responsibility for and placement authority. So the programs, which is much different than the hundreds and hundreds of other housing that our folks live in this community that we're providing supports to them. These are intentional apartments that we've developed over the year to help support people. We're also adding a mental health and addictions residential supported housing program, and there we'll also provide drug treatment services on site. So because of this new comprehensive array of services and with the addition of our data analytics program, we'll be spending the next year really analyzing the impact these services have had on individuals to make sure that, to answer the question, when people have safe and supported housing, how does that impact their overall behavioral health and medical and social needs? All right, our public health division, it starts on page 366. But I just wanted to step back a little bit and remind you all of the good work the public health department does here. We were the first in the state to achieve our national accreditation by the Public Health Accreditation Board, known as FAB. That accreditation provides recognition of our public health program that it meets or exceeds this very rigorous standard that is designed to improve and protect the health of our community. This was a significant undertaking. We're very proud of that, and we're gearing up for a FAB reaccreditation in 2019. Public Health just successfully completed a visit from Oregon Health Authority, where we were recognized for being a leader in the state for our high-quality public health services. And again, I want to appreciate the good work of the department here in those efforts. The public health system is also evolving in terms of our role and work in the community. We're providing fewer specific individual medical services and really turning our attention to the community health. And that's the focus of the modernization program. I do want to recognize Commissioner Cameron, his involvement with us in our public health work. He sits on our health advisory board. He's been very active and a nice contribution to the team there. I really appreciate that, as well as Chair Vance. So the modernization grant we received is around cross-jurisdictional sharing. And what that is, it's a collaborative effort between Marion and Polk counties to leverage resources to help meet the needs of our two communities. And so we there have started an effort around our communicable disease program and ensuring that we can provide support across the river for things like outbreaks and screenings and things of that nature. Noteworthy probably for the Public Health Department as well as other programs at Center Street. You all know that we went through a big renovation project 2016, got in 2017. One of those things was to upgrade the building, but also to create some efficiencies, so new windows and things like that. I am delighted to report that we have seen a significant decrease in our operational cost because of that, and we saw more than $100,000 savings in the electric costs in that building. So you'll see that smattered throughout the departments there in terms of reduction in operational costs. All right, so 367 we just looked at, I think. If you'll turn with me now to page 368, our health prevention and promotion program. This is the group that does the community assessment work. So this helps us look into the future a little bit, think about the health of our community. We do this in collaboration with our CCO and WVCH, Willamette Valley Community Health, and other community partners like Salem Health. And we try to look at preventing or reducing the impacts of disease and in our community. One of the big efforts we are engaged in right now with the prevention team, as well as other programs in the department, is the prevention of suicide. This year, we've lost way too many people to suicide. It's in the news every day. And we wanted to get ahead of this, and we wanted to convene and champion a notion of reducing suicide in this community. So in May, we launched a community-wide conversation. We had more than 70 leaders in our community come. I was so impressed and energized by the level of involvement with our community. We had our public safety partners, we had elected officials, we had department heads and administrators come with a call to action to reduce suicide to zero in this community. And although it may not be attainable, it stretches us. It stretches us to think about how and when, what can we put in place to ensure that we have a healthy, functioning community. So I'm very excited about that, and you'll be hearing more about those efforts to come. The prevention team is one of the programs that is scheduled to move into our Silverton location at the end of phase 2. Okay, emergency preparedness. Lot of stuff happening in our emergency preparedness department. Page 370. So what to say about this? I wanted to thank Commissioner Brentano for his efforts at helping us as a community and as a county really sharpen our focus here. With Commissioner Brentano's support, we have really dusted off our continuity of operations plan to ensure that it's comprehensive and up to date. We've added some additional staff in the program to sharpen our focus and increase our skills. Things like the solar eclipse and, of course, the water quality events that are happening right now remind us of the critical importance of preparedness. In collaboration with the Public Works Emergency Management Department, the Health and Human Services Department has a critical role in reaching out to vulnerable populations. And public health assumes an overall role in our community for coordinating medical services in the event of a community-wide event. Given that important role, we are launching an effort to train all of our staff at the health department in the incident command system, in not the entire system, but the ones that are appropriate to their work. So we'll continue to do that. So we've got people today out in the operations plan, people until late in the evening last night. We have a critical role, and we want to make sure people are well trained and oriented to the system there. Let me see, environmental health. Page 372. Environmental health certainly has a critical role. That's a high quality, a high visibility program for our department. It's where health inspections happen. It's vector control. Our ambulance service area sits inside of, we have staff who provide support there. And of course, it involves our enforcing our water quality. So of significance here on page 372 is a retirement of another longtime person in the department. Rick Sherman has given his notice. His last day will be June 22nd, after more than 30 years of service in the department. So if you hear my anxiety and my voice rising as I keep reporting on these critical folks who are leaving the department, wishing them all well, but that will definitely have an impact on our program. And And of course, it's top of mind for all of us today as we're sort of managing this event. Maternal Child Health Services is on page 374. This is a reorganized program in the department, a new name. And probably the most significant change here in maternal, child, and family is we moved our Women, Infants, and Children, WIC program, under this program. We've got some efficiencies with in a management change there. It's interesting, I'd like to report for the first time in many years, we've seen an increase in the enrollments in our WIC families. So this year, nationally and across the state, WIC services have declined. There's probably a lot of drivers for that, but we did see an increase of 7%, or more than 350 women, new women into service in this program this year. And the final program in public health is our clinical and preventive services. This is, again, a new program within the reorganization structure, and it's where we do critical services for individuals. So here we're providing treatment detection and supports to people with sexually transmitted infections. It's where our HIV prevention program sits, and we just got a grant this year to provide outreach into the community, HIV outreach, and with that comes a new van that we're retrofitting to provide those mobile clinical services. And then finally, last but not least for sure, is our administrative services program on page 379. So much of our strategic planning efforts will set here in, will be supported by our administrative services program. I feel, and I guess many of you do, that the backbone of a high-functioning department has a lot to do with the strengths and support of our administrative services team, and we've got a great one here. The administrative services provides a broad range of supports for us: personnel, accounting, contracts, budgeting, billing, compliance, and data analytics. And also, we have a very, very busy facilities team. All of those set in our administrative services area. Some of the heavy lifts as we think about the strategic plan and where we're headed is the very significant investment in the implementation of our electronic health record. We expect and hope that to be up and running in late 2019. We are doing some long-term facilities planning, and we continue to hear from us about integrating and providing a better experience for our community, and sometimes that means moving and integrating some of the services. The other thing that's really important to me is a intentional effort to better engage our employees. We've done some very significant things over this year. We've engaged them at every level possible with our strategic planning efforts. We'll be meeting with the Board of Commissioners here in a couple weeks to go over our final draft review of our strategic plan and then engage our department in the initiatives. They'll be significant and will require a significant investment from me and the department and our staff to ensure that we achieve the intended outcomes of that program. And then just again, the data analytics department is new. I'm very excited about the work. We've got some really high energy, high quality, top-notch folks in that program. And the Health and Human Services Department launched the first lean facilitator in the county. So we're in addition to the data analytics, we're asking the question about efficiency and quality of service. And so I'm very pleased with that. The final thing I'll say here is we are also adding a community coordinator with intention to reach out to the community and provide some really important messaging around health and human services. This is a big investment for us, and I anticipate great dividends in this work. So in closing, I'd like to say I'm so proud of the work of the health department. The quality of service staff provides to the citizens of Marion County is exceptional. The leadership team is superb, but we do not operate in isolation. We have achieved this because of the great collaborations within the Marion County system as a whole and our community partners, and I'm very privileged to be in this leadership role. Thank you to the Board of Commissioners, John and Jan, for your support. You have been champions for our causes, challenged us to be the best we can be, and have supported us in strengthening the great collaborative efforts within the department and the community. As you know, our most valued resource is our staff. We could not provide these critical, exceptional, high-quality services without them and your support to ensure that we remain competitive in our community to hire and retain this talented group of individuals. And a special heartfelt thanks to Commissioner Carlson. It's hard to imagine that any one person could have such an impact on a community. Your dedication to all the citizens of Marion County, the young, the old, in every community, with great and small need, quiet and loud voices, has touched so many. Your contribution will have an impact for many, many years. My deepest appreciation to your heartfelt tenacity, support, and championing of our good work. Thank you to the Budget Committee for your time, your interest, and consideration for the Health and Human Services budget. And if you have specific technical questions, we're happy to answer them now.
Thank you. Thank you very much, Carrie. And I would also, in my other role as chair of the advisory board, Health Advisory Board, I would echo Carrie's comments about the help you've been to specifically to that effort. It's amazing that that little part of your job had so much impact. Thank you.
Thank you.
Yes. Questions or comments for Carrie? Commissioner Cameron.
Oh, I
Okay.
have a few questions, but first of all, thank you for those kind words, and you're making me cry. So it's like, wow, thank you. And secondly, the Budget Committee is going to wish that I was working on the grant again today. We'll probably take up the rest of the time.
I was reading it, and there's a lot of technical problems with it, and I think you should go back
Right,
to look
yeah,
at it.
exactly. But I have like about 5 different areas that I want to touch on, and I don't know if anyone else has technical questions before I do that.
I do.
Okay.
So why don't I defer, and then I can wrap up with.
So, Carrie, I'll thank you, Mr. Chair. I'll just echo the words of Commissioner, what you said about Commissioner Carlson, and I know my colleague to my right here is like, oh, wow, there's a big hole here that's going to have to be filled, and we'll figure it out between staff and those that come after.
Yeah.
But huge contributions. I had a couple thoughts or questions. I think it was under addiction treatment. The local amount is down $212,000. And you mentioned that was a housing grant that ended.
Yeah.
Can you talk about that and where that grant came from, and what are we doing to replace that housing and the individuals that are impacted by that loss of local dollars?
Sure. It was a grant from the Department of Human Services, Child Welfare specifically, where they had identified at-risk families. Really a remarkable program, but not sustainable. So what we're doing is, the intention of that program was to provide some shorter-term stability inside of the community, in people where they had their own apartments, with transition out to long-term housing. So what we're doing is we're serving those folks in integrated settings in the community, and they get their treatment services in the clinic. So it's decentralized where people get their services. Anything you want to add to that?
Yeah, I think in terms of the actual funding impact that you see in the budget, so the intergovernmental, the federal decline is the state fund, or the DHS funding. The intergovernmental local that you mentioned, that is actually fee-for-service for the mental health services that we were providing on site, since it was sort of a hybrid where there was addiction and mental health services offered to the individuals enrolled in that program. Those were actually fee-for-service, which is why it went, when the program goes away, it sort of went to zero.
So
Thanks, Ray.
can
Commissioner
I also
Carlson has
respond to
a
that? 'Cause
Please, please do.
I met with Jim Seymour from Catholic Community Services, and they were kind of the facilitator or whatever that brought everyone together, and it was a fantastic program, or continues to be. I guess it's over, in the end of June? Is that
Correct.
right? And what he told me, a couple things. One was that when the Oregon Department of Human Services entered into the agreement with them to provide dollars, that they were providing the dollars for the rents for the clients that were living in the facility. And I think we've run into the same issue with some of the other initiatives that we've been looking at for transitional housing, because it wasn't permanent housing, DHS was counting on Catholic Community Services being able to get housing vouchers so that the rents would be reduced. So initially there weren't housing vouchers, but they thought that there would be and that their amount of contribution would decline. But because HUD and housing authorities have to follow HUD's rules, doesn't provide vouchers for transitional housing, their contribution stayed like this, and that's where it became unsustainable. So they are converting the Woodmansee apartments, as I understand it, just to apartments. And since they're permanent housing, then they'll be able to get vouchers for the clients living there. And they said they've encouraged as many clients who have gone through the program or kind of through the program just to stay in the housing that they're in. And then for the new clients, they have entered into a relationship, I guess purchased St. Joseph's Shelter up in Mount Angel, but that creates kind of a hike for the partners that would go up there. But Jim Seymour from Catholic Community Services felt like it was doable to have that up there. So
I will add, one of the things you'll see here is, and it has come before you, is a capital improvement project for her place. Because of this transition, Jim and I just met, and he agreed to allow us to use some of the housing at Woodmansee to temporarily move our Her Place women and children
That's
to while we're remodeling the Her Place program, which was a big win for us and everybody. So we continue to have these really great collaborative relationships with them.
Sure.
So we're going to get to use that.
So thank you for that. Another question for me. Child and youth program down again, local donation or local contribution down $400,000+. And all I could see was due to medication capitation and $472,000 from the general fund. Can you talk about the transition there in funding and what's causing that?
Sure. So the intergovernmental local, that is, again, fee-for-service Medicaid revenue through the BCN. So I think part of it was we were starting up our youth and family crisis services in fiscal year 17-18. We had to sort of do some rough estimates as to how much we would actually be able to bill for the individuals that access that service, what the volume would be, and it ended up really being higher than what ongoing what we believe we can bill for our youth and family crisis services. So that represents the decrease there. That's primarily sort of a, based on more trend and more information that we have now, we can make a more accurate projection into the future. And in terms of the county general fund support, this has been a consistent amount that's been offered for our youth crisis workers. We have 2 positions that are county general funded, and then there is there was, let's see, I'm trying to think what the other program was. It was, the Community Crisis Outreach Team. So that had previously been located in our acute, with PCC and sort of the acute program, and it's been realigned into our child and youth services based on sort of that restructuring when we opened up the Youth and Family Crisis Center. So those staff kind of back each other up and work together and are part of one solid team. So that's why it got relocated into this budget.
Thank you.
Thanks.
Follow up.
Continue, yeah.
A couple more.
Please.
2 navigators. In John's budget officer's message, he said 2 navigators. You have in there 64,908. John had something about 85,000. I don't understand. Can you explain the difference in those 2 numbers? I know he has 64,908 in there, and talk about that.
Sure. So the 64,000 represents the
Just for the lead program.
For the lead
We're
program,
working on,
correct.
right.
Represents the amount that was requested for county general fund support. The difference between the 60 and the 85 or whatever was the amount of carryover that we have from another grant. It was a WVCH community grant that was started our lead project, one of the transformational grants from our CCO. So we were estimating sort of how much carryover we had of that grant, and then what was needed from the county general fund to sustain that program, and then include the growth that was needed.
So for the future, just so I understand this, $64,908 is not going to get us 2 lead people. So we're going to have to come up with another general fund next year to more general fund dollars to continue that somewhere.
I think
Or
that I
grants.
think that looking at the funding for ongoing, I think is, other grant opportunities. I think also the more history and time we have of the program, we'll get a better handle on, how much billing that how much revenue they can recover through fee-for-service billing that would offset some of the costs of the program. But I do think that ongoing county general fund support will be needed, and that amount potentially could change, but a lot of factors to that.
Two more. Any money for a detox center for what we're working on with City of Salem? And I heard detox in there someplace, but I was
Sobering
trying to
center.
pull it, huh?
Sobering center.
Sobering center, whatever. Okay.
Right,
Yeah.
they're very
Okay.
Big
Yes.
difference between detox and.
One's a
sobering.
tank and one's a, never mind.
One's a social,
$300,000 in the budget for the sobering.
How much,
100,000.
where is that? I'm looking for it.
It's hidden,
It's in non-departmental general fund. I texted Jen.
yes.
Okay, so publicly, there's $100,000 not hidden, John, in the budget
We're
for
trying to keep it away from
for
you,
the
Commissioner.
sobering center.
That's correct.
Okay, I'll ask you to show it to me later.
I refuse.
All right.
Wait,
Last,
Commissioner?
can I ask a question on that?
Sure. Yes.
Is
go
that
ahead.
an additional 100,000 from last year's 100,000, or is it a rollover from last year's 100,000?
The rollover.
Okay.
Mr. King.
last one, under environmental health, any changes, I know this budget's been being worked on quite a while, but due to the Salem water crisis that we've been experiencing, is there any changes that you foresee that we would need to take a look at to respond to things like this in the future that we think are probably going to be hitting us more?
With some of the management changes in the department, we are actually looking at the supports in this program and our emergency preparedness program. So we're actually, Pam and I are, and the executive team are talking about that now. What is the right support and what kind of additional supports do we need in the program? So we are looking at that.
Okay.
So that may come forward in future.
Thank you very much. Great presentation,
Thank you.
and thanks for answering those questions for me. Thank you, Mr. Chair.
I will just follow up, Commissioner Cameron, if I could. The difference between sobering and detox, sobering is a social service, and it's not considered a billable Medicaid service because it's not a medical service. And so that's the difference between sobering and detox. Detox is considered a medical services that is billable to Oregon Health Plan and other insurances. And so when you're looking at funding, that's the critical difference, is how you fund it and where you get the funds from. It doesn't generate revenue.
So
But there's difference in
So
the
potentially,
model,
somebody
right?
that ends up in our sobering center could enter into a detox center if they've got a addiction problem.
If
and
they're
then-
willing, yeah, right?
Okay,
So,
right.
yeah, and the
That's
level of
the lead,
supports
and
and
the lead will have
services.
something to do with
Yes,
that. Yeah,
exactly.
okay. Thank you.
Did you have
I do.
a follow-on comment?
Just a couple questions.
Okay.
Just a curiosity, in the residential support services program, pretty much every other program has bilingual support and staff incorporated into it, and this one doesn't. And I was wondering if that was not necessary, or what the strategy is.
So you're talking about based on the FTE?
Yeah.
Yeah. I don't know what to, I mean, we certainly have folks who have Vermont language, Spanish, the primary language, that we are providing supports to. I don't think it's intentional, it's just
I
how
just
the-
noticed it in pretty much every other
Yeah,
category, so
yeah.
I was just curious
Yeah.
as to the difference there. Another question, it has to do with the electronic health records. What's that looking like?
Well, what it's looking like right now is we just selected a vendor to help us develop our RFP. So they're doing helping with an assessment of our need to help articulate that in the RFP. And so then once we have that finished, we'll go out for a competitive bid for selection of a vendor.
Okay.
So as we've kind of got a parallel.
What's the timeline on that?
We expect for the early 2019 or actually late 2019 for the health record to be in place.
Okay.
It's an aggressive timeline.
It
We've been
is.
talking about this for a long time.
Sure.
There are significant implications for us currently. We missed an opportunity for a meaningful use incentive, and it's central to the model of care that we're in, providing coordinated care. We can't do that without an effective electronic health record. Big investment on our part, but hopefully it will come sooner than later.
Well, I know it's really important, and and it's a lot more complicated than it appears. So
Yes, thank you for that.
thanks for doing that.
Yeah.
You ready?
Another question or another
Oh, I have like 5. There you
Okay.
go.
Well, she'll probably cover everything I ever think of. Mine are minor.
And more.
Commissioner Cameron was getting at the one I was concerned about, the water situation. You didn't mention safe drinking or whatever that is. So there's emergency management, safe drinking, some type of monitoring. I can see a lot more impact, especially if this doesn't look like it's a one-time deal. So I guess you deal with supplemental budgets, but just know that we're aware there's going to be some increased cost.
Is your microphone on?
Well, it doesn't sound very
Oh,
good,
yeah,
but it
okay, yeah,
is.
just-
Maybe
yeah,
you got to talk in front of it. Maybe no one wanted to listen anyway. Just so I can get it out of the way, Jen Fritz, somewhere in vector control is my mosquito money, and I want to know whether it's just rolled over or increased emphasis. That's,
Yes, vector control is there.
and then a bad one for the future I'd like to discuss, and maybe it doesn't happen. I'd like to know what addiction services we're providing for other counties in Oregon. Concerns me a lot, so.
I can just say briefly today, our medication-assisted treatment program, we refer to as MAT, we serve contiguous county individuals in that service. And part of the medication-assisted treatment service is a specific medication known as methadone. Over the last few years, there's been additional medication provided to people who have addiction troubles, Suboxone as an example. Methadone is a highly regulated medication, and not every addiction treatment center has it. And so people who come to us from neighboring counties and communities come because of the need for methadone. More of our primary care doctors are getting licensed to provide Suboxone, but it's a little different treatment, and the individual's needs are a bit different, so.
Carrie, this is not kind of a budget deal, it's a policy question we need to discuss
Okay.
some other time. My big concern, just so you know what I'm looking for, is that they become our citizens, just like mental health and just like jail people. The rest of the state literally pawns off their troubles to Marion County, and they become ours, and that concerns me.
Thank you.
Anyway, we'll talk in the future.
Thanks, Commissioner. Commissioner Carlson?
Sure, thank
Excuse
you.
me.
Thank you. So I'm going to go with the ones we've talked about first, and then I added a couple more here. So let's start with the sobering center. So we've established that the sobering center is in the non-departmental, and I know the health department had an initial role, Ryan and Scott. We came up with some numbers and kind of got things rolling. And in those conversations, even though this isn't in the health department's budget per se, we discussed some definite linkages between services the health department provides and the sobering center. For example, psychiatric crisis center was actually tagged to provide crisis mental health services, and there was this idea they'd go back and forth. Can you really speak to, is there any role for the health department anymore in the sobering center conversation? Should there be? And just kind of what your thoughts are around that.
Yeah, I think there is and should be a role for the Health and Human Services Department. So besides the crisis service, helping get people to the next level of care. So into sobering, from sobering to detox, and then for people who are willing to engage in treatment, of course, we have treatment services. So I think for it to be successful, we need this whole continuum of care, of which the health department provides a significant role. The other thing is our relationship with law enforcement. I think central to sobering station will be that where folks come together around addictions or mental health crisis and sobering and law enforcement. So I think should continue to build and think about our role there.
Thank you. And so with that comment, John, I realize changing the budget around and taking it out of non-departmental and putting it in makes you have to do a whole lot of other stuff. So I'm not going to ask you to do that, but I do think that there needs to be a tighter linkage and that not just be kind of a, here's Marion County's contribution, thank you very much, but we've got to have the relationship.
Mr. Chair, if I might, this is essentially a grant to essentially the city of Salem, who's running, who will be responsible for the sobering center. We're not the only ones putting money into it, so is Salem Health. So, and Carrie's correct. There will be follow-up with these folks because what's his name?
Steve Powers?
No, Tim.
Tim Murphy?
Tim Murphy and his group is going to be managing the sobering center. And of course, they do then, they will have somebody in there trying to convince these people to get into a more long-term program to take care of their addictions, if they're that, whether it's alcohol or drug addiction. And of course, the health department will have a role there also. But our money, our 100,000, is essentially part of other funds in the community that are going to help fund this sobering center as a grant.
Mr. Chair, if I could respond, though, John, you and I both know that when you put money in, you can use it as a carrot or a sweetener or whatever to get the things that you want. And we've had some difficulty with the city of Salem in terms of getting this rolling and getting it rolling in a way that everybody agreed on. I think we're at a better place now. But just to say it's a grant over here and here you go, and then, we'll deal with the details later. Maybe I need to go back and put a budget note together so that we can have that relationship piece going, because I think that Carrie and the Health Department have not been at the table to the extent that they should have been at the table in these conversations that we've been having, and that it's important for us, if we're going to put money into it, to make sure that the counties, not only counties' interests are represented, but really it represents the interests of having a successful sobering center to have them connected in a more intentional way to this money. So that's my personal feeling. I just wanted to express that.
And, Mr. Chair, if I might, I think that's, it's a good discussion to have, because the sobering center is a very different kind of task. It is really an overnight sobering center. It sobers people and gets them off the street and out of the hospital and a variety of other places, or off the street. To the extent that there are going to be services provided these people, the sobering center won't be doing that. The folks that go to the sobering center will be given the opportunity to use other services, but they won't be used at the sobering center. And that's the way I understand it, and in all the discussions we've had with Tim Murphy and the City of Salem and Salem Health. And maybe Carrie would like to speak to this, but the services to these people will not be delivered in the sobering center. It's just an overnight stay, keep them stable, keep them from dying from whatever it is that they're addicted to.
Mr. Chair, if I could just
Yes,
speak
please.
to that, though. There was a bill that was passed, and actually the sheriff and others worked on getting that extended to more. That there was, I think, 5 pilot sobering centers in the first bill, and the cap got lifted, and now it's statewide. And the provision in that bill, in order for the sobering center to have a limitation on their liability, is that there be definite connection to treatment services. It can't just be a drunk tank, an overnight stay, take them there. And so I think the original model that Scott and Ryan had actually had some peer services in there to be able to entice people to do that. I'm sure, I have great confidence in Bridgeway Recovery Services, and I know that Tim Murphy knows what he's doing, so I'm not doubting that he knows what he's doing. But I think that it would be, short-sighted on the part of the sobering center if they didn't see that there has to be some connection at the sobering center, not just an offer of services, do you want it or not? Because otherwise you're going to see the same people, and the slots, in my view, are too small for this community, but I get that we are where we're at. But if we're not going to have the same people in those 10 beds or 12 beds or whatever number of beds that they've got in there, how many beds do they have in there?
It's about 5.
5 beds, all right, yeah, there you go. So, and any given night in the Salem emergency room, I think we said there were 20-plus people, something like that. I can't remember what the statistics were, a whole lot more than 5. So So anyway, I didn't want to spend all of my time on the sobering center. This was going to be my quick one. So I have a whole lot more, and we're already at 9 minutes till. But I do want to have some discussion on this before we finalize the budget. Okay, so I'll move on to the next one. Hopefully this is a quick one too. The alternative payment methodology, and I don't know if I actually have a question on it, but maybe Brian, you can comment on this. So. Sure. And it leads back to Commissioner Cameron's question about some differences. And I was thinking perhaps that APM thing was when you were talking about that difference. I don't know if that was connected to that or not. But my recollection in talking to Willamette Valley Community Health was that we developed these alternative payment methodologies, which meant that instead of billing discrete services, lists and lists of contacts and services, we created case rates, is what they call them. And there's kind of a bundle of services that go together that we wrote papers on, and Ryan and Tammy from Polk County, did a lot of calculation. We worked with national consultants to get it done correctly. And then when we had an agreement, kind of a verbal understanding at the beginning that we weren't doing this work because we wanted more money. We had our budget. We wanted to be able instead to justify the money that we already had through the coding process. And up until we got this case rate process, we were coding at, I can't remember, it was around 50 to 60% level. And so the coding was supposed to bring us closer to 100%, although 100% is very difficult to achieve. Well, we started doing the case rates and we got up to what? They said it came in at 120% in one quarter, something like that.
I know for the year we were at like 94 or 95%, but we
Right.
did have some months that definitely
Right,
exceeded
so
our
in the initial
capitation.
months,
Yeah.
it was like kind of too high. So I mean, like, what that meant was, we weren't doing it to get more money, but it meant that it was working so well that we were actually accounting for more services than we were delivering slightly. So there had to be some adjustments. So my guess is that there's some adjustments in the budget for that, or is that not true? Or not really, because it didn't affect the money?
No, it didn't necessarily affect the funding that we were getting. It did impact how we were reflecting the costs of the services we were providing. So I think it more accurately reflected those costs to the BCN and to WVCH.
Okay.
And I think just looking at the APMs, just comparing like last fiscal year to consider that, the claims that we were able to generate using those alternative payment methodology codes was about 5.4 million. Had we been using the traditional CPT codes, the traditional billing codes that we were sort of hampered with, which we felt didn't represent the true cost of service, it was about 3.3 million. So we generated a little over $2 million in additional encounter data to more accurately reflect the specialized services that we were providing. So that has been, and those claims do go to our CCO and to the BCN. So they're seeing those costs reflected in the services we're providing. It doesn't necessarily impact the overarching budget because it didn't generate additional revenue per se, but it
Right.
really did a more accurate job of accounting for our revenue.
Great, thank you. Developmental Disabilities Program, we haven't talked about that really in any detail, and I know that there have been some concerns about shifts in state policy, state budgets, and, this is the program that just kind of quietly does its thing off to the side, doesn't get a lot of notoriety, but at the same time, it's so critical to the people that get those services. Could you just give us a brief status report on where we are with this budget in terms of serving the clients that have come to expect services and those that may be waiting for services and didn't get in?
The win this year with this budget, Commissioner Carlson, is a recalculation in how the funding formula works. So it actually created some stability. So I think the quietly doing our work has to do some with the fact that we got a win there. Over the last few years, with all of the changes at the waiver level and with K-Plan, the Medicaid service, and the requirements, the administrative requirements of the department, the program have leveled off a bit. There is a new conversation coming. Not too much detail, but one of the things the state is indicating is because of some expectations with CMS, the Center for Medicare and Medicaid, is that we need to put some space between the assessors and the case managers. Historically, they've been one and the same in terms of assessing the need of the individual. So that's what's getting most of the attention right now, is trying to do some negotiation with the state around who provides that service and what the reimbursement rate is. But mostly, people are getting access to service. We did, let me see, we had an increase in enrollments, yes, thank you, by just about 100 people this year, which is significant. I would consider that flat compared to the enrollment rates that we had seen over time. So it's just about a 3.8% growth rate there.
Great, so we're not seeing cuts to services for people like we were worried about a few months back?
Yeah, the footnote in the budget at the legislature, the state budget, was sustainable and reducing the growth rate, and so they I don't know, a few months ago, reported that due to some managerial changes, administrative changes, they are achieving the expected target on sustainability with the legislature. So,
Okay, thank you.
yes.
I'll just move to LEAD, and I just wanted to mention that the grant that they were talking about that we got from Willamette Valley Community Health, that was the one that Ashley worked on as an intern, and I worked with her on that grant, and so we were able to get our first navigator with that grant. And it also included some dollars that we included that were based on Psychiatric Crisis Center's experience. Anne Marie Banfield actually worked with us on the budget, because generally when you approach someone on the street, they're not enrolled in the Oregon Health Plan or Medicaid. So it takes a week or two for them to get enrolled, and so they may need medications right away during that time, or for some people, they may not be eligible for it, and we need to have extra dollars. And then there were some housing dollars. And I know we're putting that into the grant that we're writing to the federal government. However, that grant, we don't know for sure that we're going to get that. That's certainly would be great if we did. So what I was reading is that the decision package that you put in had the participant dollars in it, but it was just the positions that were approved. So how are you going to be able to handle those clients for the dollars that we have in the WVCH grant for housing assistance and treatment before they're enrolled in the Oregon Health Plan, if those dollars were denied in your decision package?
We do get some state-level general fund dollars to serve people who are indigent. And in this case, that's how I would consider folks. They may be eligible for Oregon Health Plan, but aren't yet enrolled. So we do have some capacity within our crisis services and within the department to provide some of those short-term interim services.
Okay, so you're not feeling like that's going to be a problem to have those that part of the budget not in there?
I don't think so. I mean, we it's part of our mission, part of the work that we do with our state general fund dollars. So this just allows us to actually, hopefully, some improvement in getting people engaged sooner.
Okay, great. Administration versus program. So I was looking, just kind of scanning through the list of the positions that you have in the administrative budget, and I noticed all of your department heads are there. You're in there. Division heads, sorry. And this is just maybe more of a philosophical question. And again, I realize that at this point in the budget, I would get a whole lot of pushback if we were wanting to restructure the budget between today and next Tuesday, or between this morning and this afternoon. But I'm wondering if we've been having this discussion at the WVCH level and the BCN level, particularly because there's such a focus now on what percentage your administration is of your total budget. And I ran rough numbers, and I would just say it's not 6% like WVCH always touts. So if that's the case, and there are positions that are actually doing work around program and quality and those types of things, would it make sense to start the process of analyzing whether or not, probably these positions have traditionally just been in admin over time, that you could move some of them into the portions of it that maybe that Medicaid would say were billable under, not the admin side of it, what do they call it, medical loss ratio side of it, just to maybe get our percentage of admin to be a lesser number. And then I do know, Ryan, that you have a federal cost allocation plan, and I was wondering, have you actually done some of that analysis in doing that cost allocation plan, or did you kind of just rely on the budget that we had here?
So I think one thing I did want to sort of clarify, so the position list, there are 45 positions in administration. That does not necessarily mean that those 45 positions are built into our indirect costs and charged out across the department. We do have some state revenue that pays for some of those positions. So when you're thinking of like the impact in terms of the bottom line administrative charge for some of our programs, it doesn't necessarily include all of those.
Yeah, that's not my concern. My concern is that someone looks at the health department and they say, your administration is almost 20%, and ours is 6%. And so therefore, you're administratively top-heavy, and we're lean and mean. That's my concern.
Right. Yeah, I think what this has traditionally housed are sort of those department-wide, organizational-wide positions that aren't necessarily linked to a specific program. So I'm thinking of things like quality improvement that are utilized by all of our programs, but they're sort of housed in sort of an administration. I think we're always kind of looking for ways to streamline those, and I think that's part of our quality improvement efforts, is looking at a lot of our processes, looking at how, looking at administration. That's a key cornerstone of that. Are all of these functions that we're outlining in here, do they better reside within programs? Do they better reside sort of as more of a centralized component? What's the cost and benefit to some of those functions? And so I do think that's an ongoing evaluation. I think we understand that, administrative costs for any organization are kind of always that area where you try to look at and say, is that appropriate? Is that proportional to the volume of services that we provide and to the infrastructure that we have to support? And so I do think that's an ongoing analysis that we're doing.
Yeah, I just encourage you to take a look at it. I know you're doing a lot of work on strategic planning and looking at the department and the restructure and all of that, just to
Absolutely.
kind of consider when you're looking at administrative percentage, because people do look at that, how that plays kind of in terms of
Right.
how others are analyzing that. Okay, last area, all right? And see, I told you I'd take you past 10 o'clock. So you talked a bit at the outset about CCO 2.0 and the state expectations around that. And one of the areas that I know I've been concerned about because of our work with the public safety and health and mental health partnerships is the expansion population. And one of the pieces that Oregon has done with a piecemeal approach, I guess, a short-term Band-Aid approach, I don't know how else I want to describe it, is they've been able to continue that expansion population, but really the jury's out, I think, in terms of where the federal government's going with that and where the state is going to be able to backfill those dollars in the long term. So in terms of treatment dollars that we need because if the expansion population goes away, then all of those folks become indigent. And if our crisis service dollars don't increase to the proportion that the population comes back, it won't even be enough. I mean, LEAD will just be our smallest concern about that, because there'll be so many people out there, as there were before the Oregon Health Plan expanded, that are without dollars for health care. So can you talk a bit on two levels? One is where you see Marion County fitting in this conversation about CCO 2.0 a little bit more in terms of the services that we provide as a provider, all right? And then secondly, more from the local mental health authority role in terms of our role as a policymaker, with your role jointly with the board, particularly with regard to behavioral health integration, and I'm even going to say substance addictions integration, even though that's not what what the charge is of the task force, but I think certainly it's been highlighted, kind of just because I think it's important for this committee to really understand how much is at stake, I think, with this particular conversation, and you kind of hit it at a 30,000-foot level, but if you could give some more concrete examples about how it impacts us specifically, I would appreciate that.
I think there's some assumptions with the integration of behavioral health and physical health with the CCO that it just happened naturally, and it didn't. There's a dynamic tension that happens between funding around how much of the bucket goes to primary care and how much of it goes to mental health or behavioral health care. I did hit it at a 30,000-foot level, but the intersection of the importance of the mind and the body are really, really critical. And so the governor and with CCO's 2.0 is really, really calling that out. There are some concerns that we haven't given that the attention and the focus that it really needs. So in this integration of behavioral health, it really means understanding what value mental health, behavioral health, and addiction services have to the overall health of the community. So we have been spending the better part of a year in our local community trying to understand that. And so this task force was developed, and we were providing recommendations to the board, the WVCH board, around what we need to do in this community, ensure that the whole care of the individual is supported and funded appropriately. There's been some, in our community, the question is, does the primary work of behavioral health go inside of the primary care service, or what's primary care's role in terms of supporting behavioral health? So that's really the dynamic tension that's going on right now. And the question is, how do we fund it oftentimes? And for us, I think the question is, how do we not support the work of behavioral health and ensuring that people's behavioral health is attended to at the same level that people's primary health is attended to? Because without it, we're not going to ever achieve the gains that are intended. It's about integration of health, it's about quality of care, but it's also about sustainability and reducing the cost of care. So if we forget this important behavioral health piece, we're never going to achieve the overall goals of the CCO. So it's really a dynamic conversation right now, and we've really rolled up our sleeves and are asserting ourselves in terms of the critical role that behavioral health has in the overall healthcare system. What's your second question, Commissioner?
So I think that's
fine?
plenty.
Yeah.
I think
Okay.
that's great. Because we're over time, but I appreciate that. And I just want to say, just to conclude my questions and comments, that I have also likewise been very privileged to work with you in your new role as the administrator of the Health and Human Services Department. And just want to say I really admire your vision, your ability to come in with your passion for this work, and look forward to working with you for another 6 months, and I think we can do great things in Marion County.
Thank you very much.
Thank you.
Okay. And Carrie, before you leave, this has been a crazy 2 years maybe 3 years for the department, with all of the building remodels and people scattered hither and yon, and retirements, and you taking on this job. I'm reminded of a photograph I used to have in my office when I was working full-time of a pilot of an Alaskan bush plane. And the plane is flying at about 10,000 feet. And it's 1950s, you can tell by his costume, 1950s, this bush plane with a great big Tundra tires on it. And he's standing, as the plane is flying, he's standing on one of those tires making some kind of an adjustment to the control surfaces on his airplane. You think, good Lord. So the number of moving parts that you are trying to navigate as you try to create a structure to handle that, and the indicators change, and the federal level things and the state level things and the regional level things that you've had to put into the calculus, always maintaining a focus on the residents of Marion County and the department's responsibility for the health, behavioral, and medical, physical health, and the oversight role of the department is phenomenal. It's very impressive. So when you all retire, you should gather together and write a book, because you're pace setting. Even something as what could be minor as having all of your people study the federal incident command system, so that when you need to coordinate with the National Guard, like you're doing this week, or with the state level services, you've got people that at least understand a common framework that everybody else is beginning to understand too. And that's ahead of the curve. So keep up the good work.
Thank you. I could not do it without this
Yeah.
group of people behind me
Yeah.
and the people who are in the office today working really hard, so thank
Yeah,
you for that.
Yeah. Final questions. Thank you very much.
Thank you.
Before, Ellen, thank you for showing up, and we're glad you're here. We have one item that's sort of in the sand running out of the hourglass as Carrie and her crew leave and you take the center stage, and that is to close the public hearing. We recessed the public hearing for comment a while back, and so it is now about 10:10. There have been nobody signing up to comment, as far as I can tell, and I'm told that there is no written comment to be read into the record, too. So we'll close that hearing formally and return to our regular order of business. Mr. Haley and Public Works.
Regular scheduled program.
That's right, back to scheduled program. Yeah. Good morning, gentlemen and ladies.
Good morning, Mr. Chair.
How are you, sir?
Nice bridge.
Is that one of the bridges you're looking for funding to replace?
Yeah, I think it's Scott's Mills. No.
Yeah, I think it might be.
It looks like the Scotts Mills Bridge. It sure
Ready to
does.
collapse.
Yeah. Anyway, please go ahead.
Thank you.
I better not say that.
Mr. Chair and committee members, Alan Haley, Public Works Director. With me today is Neil Imper. He's our managerial accountant. Dennis Mansfield, who would normally be joining us, is, well, fortunately actually for us, is at a fleet conference. So just had a conflict of interest for the budget meeting. And Neil has been key in putting our budget together, so he's a great stand-in. So this year, I'm going to do a quick review of our program budgets and then move to some significant changes from our 17-18 budget. So if you have specific questions regarding any of our programs in terms of what they do, feel free to ask them. Then I'll focus on looking ahead and highlighting a little bit of a brighter future in the near term. I will review the decision packages that we put together and go over those and some of the department's accomplishments from this past year. I'm going to have Brian May, who is our Environmental Services Division Manager, come up and talk about one of our key indicators, which is actually a new one this year that he's going to go over. And then we'll review some of our planned capital purchases along with facility projects. And then finally, Cindy Schmidt will come up and talk a little bit about our this year's CIP. And of course, feel free to ask questions anytime. So our budget starts on page 435. Public Works, as a reminder, is made up of 5 divisions: our administrative services, engineering, operations, environmental services, and building and planning. There are 14 programs in 8 funds. 7 of those programs are in the road fund, the 130 fund. Our total budget this year is $115.1 million, which is up 8.9% from $105.7 million last year. FTE is 223, which is up 16 FTE from last year. And this is really kind of a combination of positions. We've done some transferring between divisions, but the actual additions are roughly, roads and bridges are up 8 FTE. Our ferry operations are up 1 FTE. Environmental services is up 3. Stormwater and parks are both up 1 FTE, which for parks is a real boost to that program. And engineering is up 3 FTE. So looking at the chart we have on the screen here, going through our programs, our roads and bridges program is run by Don Newell as our operations division manager. It's roughly a $13.5 million budget. Emergency management, which actually reports directly to me with Ed Flick as our very active right now emergency manager, is a budget of just under $741,000. Our ferry operations is also under Don Newell and budget of $2.2 million. Our Public Works Administrative Services program, which is under Dennis, is $19.5 million, of which $15.8 is actually planned ending fund balance. Shops program, which is also under Dennis, is $3.9 million. Our communications
program, which we moved underneath emergency management this past year, and it's under Ed, is at $1.1 million. Our fleet management, again, is under Dennis, is at a $3.8 million budget. Environmental services under Brian is $37.9 million, which is up 13.4% from last year. Our stormwater management is also under Brian, which is a $2.1 million budget. County parks, again, under Brian, is a $1 million budget this year. And engineering, which is under Cindy Schmidt, who's our county engineer, is a $19.4 million budget, of which our engineering design and capital projects section is basically is $14 million of that $19.4 million. Excuse me. Our surveyor's office, which is actually under engineering as well, but our county surveyor is currently retired and not filled. It's a vacant position. We're working on that, but surveyor's office is at a $2.8 million budget. Our land use planning is under Warren Jackson, is our building official, and that's a $1.1 million budget. And finally, our building inspection program is at a $6.1 million budget, which is also under Warren. So without going into a great deal of detail of each of those programs, which we have done for several years and years, which I'm sure you guys are mostly familiar with, but if not, are there any questions on any of those programs? So I'll
Please
just
proceed.
move forward with significant changes from our 17-18 budget, starting with some resource issues. So the reauthorization of the Secure Rural Schools funds means an additional $700,000 to the road fund.
That's great.
And that's a 2-year reauthorization, so it'll be good for us. Hopefully, we'll be another 2 years after that. We can see if we make it work. We will be bringing in $409,000 from the U.S. Department of Transportation under a FLAP grant, which will be used to purchase the rock that we need for the chip sealing of the North Fork Road and Gates Hill in 2019. We had a previous FLAP grant about 7 years ago that actually paved the North Fork, and so we've been able to get this other monies now to actually go back and seal it. So we're also budgeting to receive another $860,000 from the U.S. Department of Transportation for our ferry program, which is actually an additional $300,000 over what we reported last year. House Bill 2017. So it did pass. We are expecting an increase in our gas tax funding of approximately $4 million. And overall, the bill that was passed would generate roughly $7.6 million average a year for a 10-year window. Other state revenue includes $1.7 million increase for our arts program, which is the All Roads Transportation Safety Program, and for the Jefferson Marion Bridge project. Some items reflecting the current economy. Our planning fees are estimated to be up 12.5%. It's the first time that's happened in about 4 years. Building permits are up 18.4%, and system development charges or fees in engineering are up 89%. Due to market conditions, the ferrous metal fees we receive are projected to double to $360,000. Our tipping fees for environmental services are up across the board due to increased volume. There is a continued reduction in the amount of electrical revenue fees generated for the department and for the county. It's still $2.6 million below where we were in 2013. Net working capital is continuing to build in our stormwater fund as planned per our 5-year project window. And Parks has some notable increases in revenue, including additional funds from the state apportionment, which takes into account our camping at Bear Creek. There's an increase in SDCs of roughly 43%, another reflection of the economy, and $25,000 in parking fees from the program introduced last year for the paid parking that we have up on our North Fork parks. On the requirement side, we have this year 76 production miles of chip seal. This relates basically to the $530,000 increases that we have in liquid asphalt, crushed rock, and asphalt concrete. Under our communications program, in coordination with the overall upgrade we are performing this current year and next year, New hardware and software will be purchased for $14,000 for field equipment. The importance here is that it's replacing the current PC, which is currently running Windows XP. So it's quite a valuable thing for the communication side of this, for our field folks. We are reducing our gas and fuel $510,000, which basically reflects a very small deduction in quantity, but more so a change in the accounting structure, where the fuel will be recorded into an inventory account and charged out to departments that are using it, and we will no longer show it as an expense for Public Works. But by the same token, we won't show it as a revenue either. The credit card fees in environmental services, they're going up over 50% to $100,000, certainly reflecting another area where the increased volume that we're seeing at the sites. Our advertising expense in ES is also up 50%, reflecting the efforts that we're currently doing around communicating information regarding our recycling market. There's an increase in transfer station contracts of $2.1 million due to change in the flow of materials from our transfer stations to the MRF. Instead of going straight to Covanta, and of course with that we'll be able to we'll be able to increase the recovery of material. However, this also allows for less diversion by Covanta, which puts actually more garbage at a higher rate back into the system, so we will actually see a net increase based on the tip fee revenues I talked about earlier. So it's a good move on behalf of the department and the county. At North Marion, we have a $370,000 increase in leachate disposal to lower the pond level inventory. We also have a $200,000 decrease in ash hauling expenses due to diverting ash from during the summer months from Coffin Butte. So we can put them actually into the monofill so we can regrade it, and our tarping that we will be doing in the winter will be far more effective and actually produce less leachate. Parks is increasing our temp services an additional $27,000 for a total of 8 temporary positions to assist with our current volume of visitors and to deal with the parking fees in the parks and actually throughout the 14 miles of the North Fork corridor. Our engineering services is budgeted at $340,000 to cover SDC review and to perform traffic studies at the intersection of Silverton Road and Howell Prairie and at Elin Road and Butteville Road for determining the need for either a signal or a roundabout at those intersections. So those are some of the major changes I thought you might be interested in. As you know, our budget's large, but if you have any other questions at this point, or I'll move on to our outlook. None?
Go ahead.
So in general, we have the opportunity on a daily basis to make a difference to our customers. Our goal has been to provide the services that our customers are asking for and that they actually require, with as much assistance as possible to help minimize the regulatory side of our business. So we are doing a better job proving that we are dedicated to providing superior customer service, but there is still more room for improvement in those efforts. But more specifically, from the road funds perspective, House Bill 2017, it's given us a real boost in the capability as far as funding is concerned. So we are ramping up staffing, albeit slowly, in our capital projects area, and working hard at getting some folks into our traffic engineering section, where we really need to find a competent traffic planner. We have targeted several corridors for several years for future improvements, and we now have the ability to throw them into our long-term planning, including Cordon Road and Delaney Road corridors, just to mention a couple. We should see hopefully some funding coming for the Cordon Road corridor actually this fall. So we would get going on that in the more near future than long term. We have started equipment replacement and modernization to improve efficiencies, and we will continue to do so. Our overall fleet at this point in numbers. We've reduced it by about 15 different pieces of equipment because of being able to multitask the equipment that we're buying. We can be in a proactive mode rather than a reactive mode when it comes to our vegetation and drainage maintenance, which is partially why we are hiring the additional staff this year in our operations division. We are addressing our surface management conditions in a proactive way, but price increases are going to diminish the extent of the advancement that we can see, as will inflation. We are expanding our partnerships and services to other jurisdictions, which has been seen as a very positive move forward. And our gravel road maintenance program will continue on, where we will do a better job controlling the washboarding effect on some steep sections of 15 miles on 15 different roads in the county, with a really good secondary benefit of some dust control for those areas. Moving on from House Bill 2017, we will continue our expanded efforts in emergency management to produce the COOP and the COG and the other plans that the emergency management should be doing. We have transferred the safety program out of emergency management into the administration division, and due to retirement, longtime employee, we have hired a new safety specialist out of OSU who will help enhance our emphasis on our safety program across the department, and then of course hopefully further reducing any injuries and claims. We will continue to work with other agencies, as in Turner on the Delaney Road corridor. We'll be working with Woodburn on trucking issues, Silverton on their surface management issues or program, Salem on their slurry program, working with ODOT. We'll still be doing striping for other agencies, and working closely with our Forest Service and BLM friends up the North Fork. So somewhat specific really to other programs, through engineering, staffing availability, short and long term, really is anyone's guess. I am putting in place a position similar to Carrie Muller's position that they have in the health department as a program coordinator focusing on communication. One task this person will be doing is basically delivering the county and department's message to job fairs and the like, letting them know what a great place Marion County is to work. So we're trying to reach out, stretch out, find more resources. We are continuing with our development review process amongst our interdivisional teams. We need to make sure that we are giving the best coordinated and consistent response to our customers. Transportation planning is a complex function and getting more so. With the new funding, we need to enhance not only our 20-year transportation plan, but coordinate with our long-range planning efforts from land use planning and the planning efforts that are done by the 20 cities within Marion County. We are putting together a rolling 5-year resurfacing plan that we can send out to in advance to cities so that they can focus on their ADA issues that may present themselves when we come in to improve a county road within their jurisdiction. So those ADA issues are the responsibility of the cities. And the 5-year plan should give them time to apply for grants and other funds to actually make those improvements. Within operations, although this is really a multi-divisional issue, but an area we need to recapture is asset management. So we are caretakers of a $2.5 billion transportation system, and we need to make sure that we know outright everything there is to know about our signage, about our drainage, about our signals, and all our roadway appurtenances, but additionally about our fleet, about our records, our radio equipment, and using our various data and GIS tools to do this. So we do have the purchase of an asset management program in this budget. Environmental services and parks, we are still working towards establishing a second park with camping options. We have done a study at Minto. It did not come out as really as a viable option as we had hoped for. We will continue our environmental stewardship through our new stormwater program, providing increased services in the East Salem Service District area, including additional catch basin, cleaning, street sweeping, vegetation management, and keeping those drainage ways clear. Our waste management will continue to evolve as the recycling market continues its recovery and hopefully future advancement. And building and planning, and here the future is really bright from a, as we talked about economically, from a revenue point of view. But building personnel across the state seem to be constantly under siege by other agencies. So we need to make sure that we stay competitive in the labor market within our inspectors and our plans examiners. So we need to stay ahead of that. So that's kind of what our department's future look is at this point. Any other questions?
Questions or comments?
Okay, so moving on. Nope.
Yes, Commissioner Kemp.
Thank you, Mr. Chair. Moving on to where? I'm sorry.
Decision packages.
Oh, go ahead and finish your presentation. Yeah,
Okay.
that'd be good. Thanks.
Yeah, there's a few more minutes we have left.
Come at you all at once when you're done.
That sounds good. I'll bring the team forward. So decision packages, we had 5 decision packages. The first one was $579,000 for the 8 additional personnel in operations. This will return us to our year-round vegetation and drainage maintenance practices with an enhanced ability to also respond to emergencies. We also have a dedicated environmental specialist within this package that will help aid us with the DEQ and EPA mandated environmental compliance regulations that we have to deal with. Second package is $85,000 at Scotts Mills Picnic Shelter. This improvement adds needed infrastructure to parks and additional picnic tables to a highly used park that currently has very limited improvements. Third one is $79,000 for our House Mountain power and security improvements for that communications tower. The House Mountain Tower is a county-owned facility. There is no commercial power available to it. And it is a very critical for our public safety communications for the sheriff, for Metcom, for fire districts, for public works. This is a general fund request. There's an additional 20% of the improvements, or roughly $20,000, which is funded through public works for a total of just about a $100,000 project. Next is our $55,000 for a new parks medium equipment operator. This is only the second employee assigned to parks, and will provide better year-round services to all of our facilities. The MEO can operate equipment that requiring a CDL, which will better improve our parks, as well as they can assist across all facets of park maintenance. And the fifth one was $5,000 for parks new signs, which is actually a continuation of the last couple of years. The board had asked us to take a look at improving our signage, fixing our signage, adding signage. So that's what this continuation will be with this $5,000 for the coming year. So moving on to accomplishments. So we resurfaced 17 miles of road and chip sealed 65 miles of road this past year. And we are moving to 25 miles of resurfacing and 76 miles of chip seal this coming year. We completed 3 roadway improvements. We added sidewalks and bike lanes on Delaney Road between 3rd Street and 8th Street and Turner. We extended the Silverton Road acceleration lane and created a right turn lane from Cordon Road to Lardon Road. So we relieved some congestion with that project. And we reconstructed the railroad crossing and installed crossing controls at St. Louis Road. We successfully performed a 5-year haul out of the Wheatland Ferry for Coast Guard inspection. So we've got another 4 years now for Buena Vista and another 5 for the Wheatland. Installed free collection stations at Bear Creek, North Fork, and Salmon Falls Parks, and along the whole North Fork corridor where new parking permit fee was instituted. Getting a little specific, building inspection had 4,567 out of 7,522 building permits applied for online through our e-permitting program. So it's becoming a big success for us. and we were able to eliminate the backlog of septic permit applications. We performed effective traffic management for the 2017 solar eclipse. We did that across our county road system with really only one minor, well, for those that were stuck in it, it was probably major, but area up on Howell Prairie after the eclipse. We provided 300 feet of storm water channel bank stabilization affecting 11 homes near 45th Street in East Salem. And we installed 3 manholes relieving persistent localized flooding affecting 20 homes and traffic on 46th Avenue. And in December 2017, Environmental Services helped administer 2 pass-through grants allowing Marion Polk Food Share to recover 516,000 pounds of food from retail stores within Marion County. And we allowed the Northwest Hub to introduce a bicycle recycling receptacle as skirts, where they were able to recover 30,000 pounds of bicycles and bicycle parts. And from the material collected, 858 bicycles were reclaimed. And of that, 524 were made available to low-income and homeless people in our area, or were sold at a very low cost. So it's a brief review of our 2017 accomplishments. So I'd like to have Brian May come up and talk to you about our key indicator. This year we're going to look at our transfer station trends. So, Brian May.
Morning, Mr. May.
Good morning. So Alan's asked me to kind of give a quick synopsis of our new transfer station trends. I think it's mentioned by Mr. Latimer here this week that we've seen some good growth in Marion County. Along with that, we've seen growth in the waste stream that's been impacting our facilities. This new indicator is meant to provide some more transparency to what that impact is and how it's going to be seen within the community and how it affects us. It's going to focus primarily on our 2 transfer stations, the Salem-Kaiser and the one up at North Marion, along with our Browns Island construction and demolition landfill. When we look at the numbers in the packet, calendar year, the comparison between calendar year 15 and calendar year 17, we've seen almost a little over 30% increase in the tonnage that we've received at our transfer stations, along with a customer traffic of almost 18%, or a growth of almost 24,000 people over a 2-year period. Browns Island has seen the same kind of significant increase of about 27% in volume. With this is going to help us kind of move us forward as far as our projections and anticipating needs. With us at about our midpoint in 2018, we're still seeing this growth continue. We're on about a 10% year over year for the next 2 years, anticipated of about 20% increase. This is impacting that customer service level that we do want to provide at our sites. If you've experienced the waiting line at Skirts on the weekends, you have a direct impact of what we're talking about and how we're moving forward to adjust those needs. So this will just basically allow us to look forward, anticipate, and try to help move flows in the county and provide that better customer service.
So, questions for Brian?
Nope, go ahead.
Wait,
Thank you.
Mr.
Yes,
Chair,
sir, Mr. Cameron.
I was there Friday before last at 7:45. There was already a line out the door.
At the door, yep.
Or up, I think they opened the gate early and we were lined up the gate. So are we talking about building another road on the side there? Is that what,
So,
potentially
yeah.
so you can get into the recycle area without waiting through the line?
So we're having those conversations with Republic Services that owns the site that has a franchise agreement with us. So we're looking at overall traffic patterns to reduce the impact and also ways to move a lot of our construction volume possibly to the MRF, which would free up a lot of the tip spaces and move traffic through at a faster rate. Some of those shorter term things that aren't necessarily construction oriented that would divert traffic again away from the site, but to keep it funneled appropriately.
Okay, thank you.
Thanks, Brian.
Thank you.
Other questions? Okay.
So I'll just briefly go over some of our basic capital purchases that we're doing. The ferry program has budgeted $900,000, which is federal ferry boat funds from several years that we've accumulated. We'll be using those this year to finally put up our electronic open-closed signs for both ferries. We'll be doing some ramp improvements at both ferries, and we'll be purchasing some extra ferry boat parts. This is really a combination of Phase 1, Phase 2 of these monies. In 2019, we'll be doing some larger improvements at both ferries, which we're entitling Phase 3. We have quite a few site improvements at Silverton Road campus, including our stormwater pond. We're doing an upgrade to it to get in line with the same requirements we put on other people for handling stormwater. We're also putting a new PGE line extension to the west side of campus, which will help support some electronic vehicle stations that we'll be installing. But it'll also provide the power needed for a new facility that we're looking at. It's in the budget this year for a design for the replacement of buildings 2 and 3, which are our shops buildings. But there's not enough power on that side of the campus, so it's getting this part done now. We're also adding a pipe camera system to our stormwater program to better assist our efforts in keeping our culverts clear of debris. Overall, vehicles and equipment purchases this year are about $1.8 million. Some other facility improvements that we're doing, we're kind of culminating a 7-year plan that we've had at Silverton Shops to put in a new 5-bay building. We'll be putting in a fuel tank at Browns Island. We're doing a transfer station floor repair at North Marion for $157,000. That's a carryover from a $300,000+ project this year, but it's re-looked at it, redesigned it. We'll be getting it done next year. And then at Denny Park, we're spending $82,000 for a new restroom. So from our capital projects review, I'm going to have Cindy Schmidt come up and go over a few of our projects that we have upcoming this year.
Good morning.
Ms. Smith.
Thank you. If we could go back to the previous slide, just wanted to point out some highlights of, thank you.
One more. Thank you.
This has been an exciting time from the capital improvement front because we've been for a number of years so successful obtaining various federal grants for projects. We got a little backlogged, had some staffing issues, and we're working very hard to staff ourselves up to get ourselves back on track. And then House Bill 2017 has injected some funds over the next several years. So we're ramping up our efforts considerably. And we have some really good projects online for this year. And I just kind of wanted to highlight maybe 4 different ones on the list that are bolded there that kind of show the variety of projects that we do. The first one is our pavement preservation program, which is our contract overlays that involves overlaying county paved roads as well as grind and inlay types of restoration projects. And this has been a very big year for us. So we've got $4.8 million budgeted. We've had a successful bidding year so far. The contracting community was very engaged. We ended up issuing 3 different contracts to 3 different successful companies, which distributed the work very well. The bids were very competitive, and we're very happy. And the one contractor who is doing work that has to be done prior to July 1 to finish off the current budget year is already working on his projects. And so we look forward to having a real successful year there, and we'll be covering roughly 22 miles in this season's work, and then we will finish an additional 3 or 4 miles in the spring contract that we'll have next year. The second project I just wanted to highlight is the Jefferson Marion Road Bridge Replacement. We were able to obtain federal bridge replacement funds for a couple of bridges. This is one that we were able to tackle first. It's on Jefferson Marion Road down near Pletzer Road in South County. It's a fairly straightforward bridge replacement project. It's not a very large bridge. It didn't require a lot of right-of-way. So we've got $1.67 million that will in the fiscal year budget for the construction phase. The total project cost is roughly $2.4 million, and the construction actually started last Monday. And the road will be closed for roughly 10 weeks, and so there's a lot of pre-notice and orchestration with all the businesses and parties that are affected when you do a road closure like that. So it'll be exciting to get this bridge replaced. And the other two projects I wanted to highlight are more urban area type of projects. 45th Avenue, number 6 on the list, is an urban upgrade project that will complete the curb and sidewalk and turn lanes on 45th Avenue on the backside of Chemeketa Community College between Silverton Road and Ward Drive. Again, that's a federally funded project. We're roughly 75% of the way through the design phase and 50% through the right-of-way acquisition phase. And these kinds of projects involve significant coordination and right-of-way acquisition. And this project alone, we had roughly 47 right-of-way files. So there's a lot of work and involves consultants and county staff. And we're hoping to bid this project by the end of this calendar year for construction over the next 2 summers. And then the last one is more of a maintenance type project, number 9. It's a traffic signal replacement at Lancaster Drive and Maclay Road. It's one of our mini signals is quite old. It needs to be replaced, structurally not very sound, so we were able to obtain, again, federal funding that would allow us to replace that, upgrade the signal, last another 50 or 60 years, hopefully. And we're also, as part of that, doing some ADA improvements to bring everything up to code and to establish some facilities. It's a very heavy walking area, and make some improvements to the bike lanes. So those are examples of projects that kind of span from bridge type work to more of your urban types of facilities. Happy to answer any questions about any of those projects or anything else on the list that interests you.
Questions or comments? No?
Actually, that's the basic end of our presentation. So if you have any questions about the budget period across the board,
Where'd he go?
where would you like to start?
You'll just have to wait till our questioner comes back.
Actually, if,
David, you
oh,
have a
never
comment?
mind.
Actually,
Go
I think
ahead.
if, under the emergency management program budget, it shows materials and services expenses are down from $500,000 to about 200,000 or so. Can you explain what that is and what impact it'll have on services?
That was actually more of a supplemental budget that we did last year to actually increase those monies for the emergencies that we had last year. So it's actually kind of holding the line, if I recall correctly, that it's more in line with previous years. But I'll look it up.
It is more in line with the prior 2 years.
Yes. Yeah, so the biggest issues I think that we had there was definitely related to the emergencies that we had. With needed funds, we had for food, for services that we provided for, and it was directly related to the eclipse and the fires that we were handling last year.
Okay. Commissioner Cameron?
Thank you. I didn't miss my opportunity.
No.
I can hear everything in there. That's why I go in there, because there's speakers in there. and
It was
I can-
close.
Huh?
Is that why you go in there?
Just to listen.
Keep going.
Just a minor detail, there is a speaker in the other room, so if anybody needs to hear what's going on, you can always do that. Okay. First of all, I want to say a couple things here before I ask a couple questions. I want to thank Public Works Department, specifically Cindy and her department, for all the work they've done up in North Marion County to help with the traffic safety situation up there for those residents, and the increased traffic and all the engineering that's been done and the work that's been done up there to increase that and reduce the accidents, along with the Sheriff's Department and adding that deputy. We've made some great progress up there, so thank you very much.
Thank you
for that in the last year and a half. For the support of Little North Fork and the things that have been going up on there with the parks and improving the parks in general, but also in for those citizens up there, and making it a better place for them to live and have people recreate at the same time.
Signage there too.
Yeah, all those things that have been done up there. It's great to see the cooperation and the work that's been going on up there and getting some more help in the Parks Department. And you mentioned $5,000 for the sign. I think we could find that someplace. The signs look great every time. Of course, obviously, I'm driving back and forth every day now, and every time I go by those new signs, I think, okay, we're making some changes and continuing to see that. One of the things that I wanted to make a comment on, Alan, is on the key indicators, number 5, the number of permits by type. I would assume you have more detail than just what we see on the budget document by the types of permits. But I would want to encourage us to revisit the key indicators there and not only talk about the types of permits by detail, but the time it takes to have permits issued by type, and that we start tracking that and have some sort of measurement criteria that we can show the progress we're making with the increased staffing levels that we're putting in the budget, whether that's a building permit or a septic permit or motor carrier permits, etc. I noticed the motor carrier permits are going down because of the online ability in the comments, but if that's something that's possible to do in the future, it's more of a question, I guess, what we can do today and what we could do in the future.
Well, you're correct. We do have a lot more information about these items, and hence the specific detail about how many permits we're doing on e-permitting. We generally hold to a standard in terms of what permits we're issuing and how many days it's going to take us to issue those permits, whether or not it's a plan review or it's a building permit, or as you know, septic permit. So we try and stay within that kind of a window. I'm not sure that we're actually tracking specifically this permit took 6 days, but I will check on it and see how we can add and add to this indicator.
But then that would be really good, because if we do have an expectation, we need to know. I've always said inspect what you expect. So if we have an expectation that should be doing this, we should be able to see if we're meeting that or not. So thank you.
We are meeting the timeframes that we have established for issuing decisions, whether it's a 30-day window in planning or whether it's a 10-day window for issuing or getting plans out the door. So we are meeting those time limits, but getting the specifics about how long it takes to issue any given type of permit, I'll check into and see if that's something we can report in here. So that'd be a good addition to the indicator.
So you're saying that we have a 10-day window to turn around plans, and we're hitting 9.5 days or 7.5 days
or something like that, yes.
It'd be good to have that information.
Depending upon what the permit is, we have deadlines for each of those things that basically are statewide.
Okay. Thank you.
Thank you. Other questions, comments from Mr. Haley? No? Thank you very much.
Thank you. Thank you, Mr. Chair.
Jeff, I see.
We were able to catch you up a little bit.
Yeah, I appreciate that. I see Colleen's out there, and I see Mr. Emery's out there. Oh, I'm sorry, yes. I'm just anxious to move along here. Yeah. Yikes. Would you want to stay on track, you want to take until 11, take about 10 instead of 15, so we continue our rolling forward?
Sounds good to me.
Does that work? Okay, we'll break and
got
then
9 minutes
reconvene
till
at
You
11
used
o'clock.
some years already.
Okay, we'll return from break and call the Budget Committee to order. Next item on our agenda is capital improvement projects. Mr. White, Mr. Emery, and Ms. Coons-Chaffin. And there you are. Thank you.
Good morning, Chair Vance, Commissioners, members of the Budget Committee. We are here. I'm Jeff White, Chief Financial Officer of Marion County. We're here to go over the capital outlay portion of the budget. As you have seen throughout department presentations, some departments have some capital outlay projects within their departmental budgets and funds, and some do not. And then we have a capital section of the binder, which is this blue tab that says capital beginning on page 547. It captures all those non-specific departmental related budgets. I'm going to do a little bit of orientation with you because we're going to present the capital outlay from the 5-year binder you have in front of you, the smaller one, but it relates to the big budget also. So I'm going to point to some pages. You don't have to turn there if you don't want to, because we'll get to just going through the specifics in a moment. So on page 547, you see how our capital budget programs are laid out, funds and programs. Just as any other departmental first page, these are the programs for all the capital budget items that are not included in other departments. If you turn to the next page, page 548, you'll see that we have 3 funds for these capital projects. And on page 549, you'll see that we have 7 programs. That's how we track all of our larger capital projects, except for Public Works and a few other department ones. You'll see that our, I want to have you turn to the very, if you'd like to, the very last page of that capital section. We do a summary that will show you by fund where all the capital budgets reside for a total of $43,046,926. That's the amount of money Marion County will spend on capital projects this year. For discussion purposes, to make it a little bit easier, because within those pages in the budget book, we've got IT projects and construction projects and building projects and equipment purchases kind of mixed in those pages for various reasons. This smaller binder, it is grouped by type. That's why we're going to use that to go through it. It'll be a little bit easier to follow, but the numbers do all match. So if you can turn to this smaller binder, the very first section called Summaries, you'll see that we've grouped the projects by IT, by facilities, by Public Works, Sheriff's Office, and building projects. I'm going to have you turn to this page to begin kind of our conversation. We'll be flipping back and forth in this binder as we go over the projects. But if you flip to the final page in that summary section, it should be page 4, I think, but it's been, in mine, it's been punched out by the hole. What you'll see is that all of these projects together, it's broken down by fund. The general fund, about $43 million worth of capital outlay, the general fund is going to cover the cost of $4.5 million of that, and then all other funds will cover $38.5 million of those projects. The following pages behind that summary section, you'll see the tabs for information technology, business services, Public Works. Each of these folks will be going through those in a minute to go through some of the highlights of the projects. They should be in the same order as found on the summary pages, but there's more detail to each item if you want a little bit more information about what the specific project is about. If you go to the very last tab, Other Departments, to page 55, I believe, or sorry, 51. This then summarizes our 5-year list of capital needs that adjust all the time. In what you're going to adopt, you'll only be looking at fiscal year 18-19. And again, it summarizes the total by type: information technology, facilities, Public Works projects, Public Works equipment, and other, and then building projects by general fund and non-general fund. But you can also see in the future 4 years the kinds of dollars that have been identified that the county department staff believe that they'll need. You see a total of $141 million over 5 years that we will need to sort out, but we're specifically going to look at the first year for this capital budget process. Finally, the next few pages are more just informational. You can see projects by, on page 52, you'll see IT projects specifically listed by year, so you can see what kinds of things we're doing, when we anticipate doing them. And I think finally I want to have you look at, flip ahead a couple pages to page 55. We've tried to identify on the Public Works projects, because those projects cover many years. It's not just we're going to do a project now and then a different one next year, but they're multi-year projects. So we've tried to put together a schedule that will let you see how much money to date has been spent on one of those projects, what's in the FY 18-19 proposed budget, and related to that project, specifically what will come in future years. We're not going to go over all that today. Just wanted you to know that information is there if you want to look at it and hopefully answer some of your questions. So I'm going to flip you back now. We'll start the actual process of going through the items. On page 4 of the summary section, I'm going to cover a couple of the miscellaneous items. Yes, perfect. Thank you, John. You're right on time. You stand back. Oh, Jan's right on time because Jan knows what we're doing here. So I'll cover the non-IT and non-facilities items briefly. You'll see that Public Works, whom you just heard from, there's their total capital outlay projects of $17 million. You see that broken down of $206,000 in general fund monies and $16.8 million of non-general fund monies coming from those various funds. The bulk of it, obviously, the Public Works Fund of almost $15.2 million for their projects. Their Fleet Management Fund, those are for our internal vehicles, how we manage the vehicles the county staff drive, $1.2 million. And then the other Parks, Environmental Services, Stormwater, and Building Inspection Fund. You can find the details of those projects again in the detail section of the tabs. The other section I need to go over is the Sheriff's Office items. Again, we're on page 4 of the summary section. The first 4 items the sheriff addressed. His radio phase 3 project for $222,000. He talked about a clothes washer and dryer. We budget for one of those every year on a continual replacement plan so that they don't have breakdowns. Those are $20,000 combined of general fund money. And then finally, an industrial tilt skillet for their kitchen at the jail for $17,000. 4 items that I don't think came up directly in this conversation, they're smaller items. You'll see their non-general fund budget estimate. We always budget for a K-9 replacement in case something comes up in the line of duty that we need to do that. Fortunately, we don't generally spend that money, but we appropriate it in case. The sheriff has a van that they use to analyze crash data at crash sites. They're going to put $50,000 worth of high-tech equipment in there that'll do a better job of helping them analyze those crashes and how to make things safer. And then he did talk about the extension of enhanced public safety services in the East Salem Service District. We've got some capital outlay for computers for some vehicles that will need to be purchased. There are actually vehicles included in that fleet program fund budget for those deputies who will be serving out in that area. And then finally, body-worn cameras project. We've appropriated dollars for that item because there's a grant that's in place. There are some significant policies that need to be resolved, and the sheriff has indicated they want a budget authority if the policies can get resolved. If not, they won't spend those funds either. Do you have any questions over those things we've talked about? If not, we're going to turn this over to Scott Emery now to cover the IT section.
Good morning, Chair Vance and committee members. Scott Emery, Information Technology Director for the record. The Information Technology Department, in conjunction with the department heads and elected officials, have developed a 5-year technology roadmap that addresses both business and operational needs. For the 2018-2019 budget, there's a total of 24 new and continuing projects with over $7.5 million in capital technology investments. New investments reflect a 106.3% increase over the prior year, with this preponderance directed at remedying 2 specific risk areas for the county. First, there are large business systems at risk due to obsolete equipment and rapidly diminishing support by the supplier. In several cases, only a single person working for the supplier has the knowledge to keep the systems going. Further, many of the systems at risk hold sensitive information, and we're obligated to ensure the information stays secure. Second, foundational computing infrastructure that has served us well in the past is starting to fail, as a majority of the equipment has exceeded their life expectancy. And compounding the situation, the systems are developed organically or by point design with little forethought about the future and scalability. So I wanted to be able to talk about 3 of the really most risk-prone large business applications, and then the 3 areas around infrastructure in general, and certainly take any questions we may have in between. The 3 large significant risk areas that we have are one for Health and Human Services Department in their electronic health record system replacement at estimated $3.3 million. We heard about that a little bit from the Health Department earlier. But given the size and impact of the effort, we recently retained an outside expert consulting firm to assist with scoping the requirements for the system and providing counsel on industry trends and direction. Further, having this level of expertise helps us reduce risk in delivering the new system. The Health Department is a very complex department, and we want to make sure we do the job right. The second one is the Sheriff's Office Record Management and Jail Management System, or as it's denoted on the slide, the RMS-JMS system. It's a 10-year investment to be able to replace the system at around, we're forecasting $500,000. We think that's in the first year. We think the cost may go down in subsequent years. The Sheriff's Office, Contracts Department, Legal, and IT have been working jointly on system requirements for more than 3 years to get ready for this. And that we plan to release the request for proposal in the next 30 days. This particular system is the end-to-end functions for the entire Sheriff's Office, so it's pretty critical for them. And finally, completion of the district attorney case management replacement started this fiscal year will come in at $622,000. The benefits of this new system are numerous, and the ability to reduce the number of printed documents that need to be carried from building to building will greatly increase productivity of the DA staff. This particular system doesn't actually get paid for until it's up and running. So we were able to take advantage and make sure we reduce risk to the county by only paying once we got the functionality. Now I'll shift to some of the key infrastructure areas. Many of the new infrastructure improvement projects are multi-phased, as noted on the slide, spanning multiple years. The purpose for doing so is to minimize the risk, and by taking large work efforts and breaking them down into discrete investments that are easier to manage and reduces potential financial impacts should something go wrong. The 3 areas of focus in the coming fiscal year are rebuilding our network infrastructure, which is budgeted at $1.4 million. What's happened over time is we used to have all of our lifeblood in the county being our information or data that flowed from campus to campus. But now with many of those services being external, the data is reversing course and going in and out of the campus. Our networks weren't designed to do that, and so we're starting to hit some bottlenecks, and hence the multi-year investment. Next year is only deemed to actually kind of work the foundational areas, which means in-the-ground, fiber, core network systems. There's 7 layers in totals, taking a course of 5 different years with reducing amounts of investment each year. The next area of concern that we're going to address is our core computing infrastructure at $67,000. Really, this is a startup. This is kind of ramping up. Our larger back-end computer equipment is, again, past end of life for their serviceability, and we need to start looking at things like cloud computing, these new terminologies for the county, and looking at scale and economies that we can get by the market. And lastly, we do have a need to focus on our information security. We have $110,000 in this budget for improving our policy, monitoring and security tools, as well as educating our employees on how to handle those phishing attacks where, in fact, they can infect the county. On the next page, we have what we call carryover projects. These are projects that are in flight and they're in different phases of effort. Most of them are in fact halfway in between. Some are out for contracting, some are nearing completion. There is a lot of continuing focus in and around video, surveillance video throughout the county. In the past, it was funded individually, initiative by initiative, and as we heard on Tuesday, we're going to move away from one-time investments and actually start to make sure we have some recurring dollars in there so we have life cycle replacement pre-planned. And with that, I want to make sure that I thank all the members, which are the department head elected officials that form the Information Technology Governance Committee. They're the ones that help us kind of take all those requests and kind of funnel it into a 5-year technology roadmap that is pretty complex and challenging. And I also want to make sure I thank that the Budget Committee for patiently assessing and supporting what can be difficult decisions and trade-offs in selecting the technology investments. It wasn't easy. There was a lot on the table. They also are holding us accountable, make sure that we bring in that expected value. So I certainly very much appreciate not only their support, but their desire to make sure that we deliver good quality systems for the county. And with that, I'll take any questions.
Thanks, Mr. Emery. Questions or comments for Scott? No? I would call your attention to page 53, and it's that spreadsheet that talks about the 5-year plan that Jeff had talked about earlier.
Yep.
With regard to, while the details for the 18-19 and the 19-20 budget aren't there, it's heavily loaded right now. $7,544,000 now, down to 2 and 3 and 3.5 and 4 to a tune of $21 million at the end of the time. it's heavily loaded, and that refers back to your comments earlier about the need to bring some of this stuff up pretty quickly.
Absolutely, that's part of it, but I gotta be clear, there's another part that's not as present. In the past, the notion was one-time investments, so we actually had capital items. The trend is to go towards services away from products, which means our expense, our reoccurring costs are going to increase over time. That's not represented here in clear terms because this is one-time capital investment.
Yeah.
So if you will, there will be a crossover point where suddenly the capital investment will go down and the expense will start going up.
Yeah, no, I'm not challenging it at all. I just
Right.
wanted to know in my own mind why it goes from a big number and then it drops precipitously, but it says
It is a combination of both the near-term needing to correct that, what I would
Yes,
call the
yes.
foundation of the house.
Exactly.
That's absolutely true. Yet at the same time, as we get into the out years, more and more of those big applications and systems we're talking about will actually be hosted external to the county, and those start to increase our reoccurring costs. So it's not a one-time investment, it's a continuous investment.
Okay,
So there
okay.
is a shift in dollars, if you will.
Interesting. Okay, that adds another layer of
Right.
confusion. Thank you.
Sorry.
Thank you.
Yeah, I
Other
actually have
questions,
a
David?
follow-up to that, which would be, what's your expectation of the impact on the county staff level to be able to do support versus having the outside vendor or suppliers providing support for systems?
Yes, very good question, excellent question. You know, information technology is driven by its people and their skills and abilities. As time goes on, though, what we are seeing is a shift to technologies being a commodity item. It's ubiquitous to actually have a mobile phone that actually has a very powerful computer built into it. We'll make sure that we take advantage of that. One of the things that is changing and has been changing is going from kind of an operational IT to more of a vendor-managed IT. There's going to be so much more because just the choices that we have are something that are external, and we will have to be able to manage vendors better. We'll have to be better at contracts management. Simply even just upgrading our email system that we're talking about doing here in year 3 actually is more an external event than it is an internal event. So again, our shift of how we have our staff structured and our skill sets will have to turn more to being able to manage these services coming from outside vendors. I'm not sure, did I answer your question for you?
Which then has an impact on security of the systems and being cognizant of how the security of each of the vendors'
Absolutely.
operating systems is
And hence the
governed.
investment not only in new staff for security, specifically around security, but also with respect to the tools that they have to monitor the performance of those systems.
Thanks, Scott. Other questions, comments from Mr. Emery? Okay, thank you very much. You're up, ma'am.
Thank you, sir. Good morning, Chair, Budget Committee. Colleen Kunz-Chaffins, Business Services Director. Projects are listed on page 550. I'd like you to know, in bidding all of these projects, we endeavor to strive and work with many local architects, engineers, contractors, and subcontractors so that the local economy also benefits from these projects.
You can also find them on that page 1 of that summary
I'm
section,
sorry.
the smaller
Thanks,
binder.
Jim.
They're in the same order as will be on the slides.
Marion County has greatly benefited from the expertise and eagle eyes of our in-house staff, and I'd like to point your attention to Kevin Burton in the back, if you'd raise your hand, Kevin, and Larry Tilford, who are really the guys on the floor who are really helping us keep track of our contractors, working with our teams, building the rapport, and establishing the collaboration with our departments. Without them, this would not be possible. There's a bunch of projects there, and I'll just go through a few of them. If you have questions, feel free to ask in the middle of it. They're replacing the jail boilers. They're at life cycle. They're ready to go. We have some ModCon units in there that we'll be replacing with lock-in bars. If you have any information in that technology, that's what it does. Better serves the jail population there. The second one is the paving of the jail parking lots and driveways. This is kind of phase 2. We did a little bit of phase 1 last year, but with the new project going on, we halted that paving where we didn't want to have redundant. So when this project is completed, we'll get working with contractors and getting that parking lot done. Transition center improvements are, as we discussed on Tuesday a little bit, those will occur after we get moved into the new building, which we'll discuss in a little bit. To kind of reorient some of the transition center where the CDO, where the central district office was, what's going to be there, and working on part of the Demunis Center there, but what's also behind it, and extending and basically putting some walls and doors in. to make that more efficient. The next one down the line is the new juvenile administration building furniture. That's for the furniture, and I'll talk about that project in just a moment. Transition center roof, we'll finish that up this summer. The HVAC is 99% done. We've got a few things left to do in that, but that's going really well. We've got a fully ducted system there, so that's working, and they're transferring twice the air out that they used to transfer out. And if I could show you the ductwork, you'd all be clearly grossed out by it. But right now, it's all new and all clean, and it's going to stay that way, so we'll be looking at that. But the roof goes on, where the roof has started a small piece of it, and the rest goes on, will be finished, and we need a 6-week weather window. That'll be finished. The courthouse audible alarm system, as mentioned on Tuesday, also is for this building. It's more or less a notification system that we'll be putting in. The health roof replacement, we did some minor repairs on the roof, and then as we got into it and started really doing some of the inspections, we just noticed that it's time to do it. It is a life cycle thing, so that's part of that building. The next one on there is the Health Silverton Road phase. It's an additional 17,000 square foot that it's a lease that we're doing out there on Silverton Road, right across from the fairgrounds. If you want to take a tour out there, we can get that for you. And that's 698,000 to finish up some of those projects. And some of those things, there are some things built into the lease that we've asked them to do, but also keeping in mind that some of those things are for the landlord there, not necessarily for us, that I didn't want to pay for through the lease, like an elevator. That's going to be a long-standing thing that won't come out after the building, after we remove that building. It's a 10-year lease there, so yes, we're investing some funds there, but it'll give Cary totally about, and Health and Human Services, approximately 38,000 square feet in that total building. So where we also, I just wanted to, as we look at some of these projects and a few other ones, there are some that we're looking at consolidation and aggregation of projects. For example, Commissioner, you had asked about, I'm coming back to it, the juvenile restrooms at the Logan building. There's actually 3 restrooms there.
Thank you.
There's 3 restrooms, and it's replacing all of the sinks, the toilets. There's tile, there's flooring, there's mold, there's not mold, but there's mildew. There's stuff that needs to be addressed from those areas.
If I remember right, it was 92,000, I was concerned
Correct.
with being one restroom. So
Yes,
we
sir,
have
there's 3. There's 3 restrooms.
$30,000 a restroom.
Correct. And I have a project book on that if you'd like to see those. So where we can, we aggregate and consolidate these projects. So the shower stalls, we're actually going to combine probably a procurement here with juvenile shower stalls down with our dog shelter wall coatings, because we use the same type of epoxy. And it's really a water sealing company that we can aggregate and get some bang for our buck if we do that. So we're looking at opportunities to do that. And now I'll go on to the building projects, unless you have any further questions about the projects in this list.
Questions about projects? None? Go ahead.
No. Well,
Oh,
Mr. Chair.
I'm sorry, Commissioner, please.
Well, my colleagues here made me the designated dog dummy, and I can relate to how a shower relates to the animal, the dog shelter. It's an inside baseball joke, I guess.
It's epoxy and waterproofing, but it works. Yeah. Okay, so first we'll talk about the juvenile administration building. It's a 20,000 square foot facility that will house juvenile administration, parole officers, education advocates, family support teams, and district attorney's office. Conference rooms allow for family counseling rooms as well as training areas for the teams. There's a total of almost $3 million in that project. This is a construction rendering of that. We're almost through construction docs at this piece. We're hoping that we break ground about the same time that we close up the public safety building. So we'll be breaking ground here in late August, early September. That's the goal.
Colleen, where will that be located?
This is located on Center Street. It'll be located right in front of the juvenile detention building. So you can see
closer to the street side.
Closer to the street side, in between the counseling house and in between the detention center. It's right in between there. And you can see where the new, up to the top corner there is the new state courts, and I'll talk about that in just a sec. So that's attached to the current detention building.
Okay.
So this building will go right in between there.
Okay, thank you.
So this project is $9.3 million. Completed is the juvenile court project, which is right behind that. It's a 3,300 square foot expansion of the juvenile detention building. Staff and judge are moving in this weekend and will be in operation on Monday. So the grand opening is scheduled for early August, so we hope to see you there. And on this project, we had great collaboration with state courts, juvenile, and our contractors. Andy Medcalf Construction did an awesome job. Their superintendent, Bob Smith, was awesome to work with. And Carlson Vite architect, Angela Flores, has been phenomenal working with us, and Kevin specifically on this project. So it's been really good. The next building we'll talk about, and there's a picture of the juvenile courtroom. You can see it's kind of more it's modern and more contemporary. That's kind of where the architects are going these days. So we're trying to just keep up with trends, and it does tie in with the current facility. So that's, again, we're opening up on June 11th. Court will be in session on Monday with Judge Pettigrew. The next project we'll talk about is the Sheriff's Public Safety Building. You're all aware of this project. It's a 30,000 square foot building. This is on schedule, substantial completion for late August. We'll move in early September. Building is built for joint occupation for both parole and probation and enforcement units. Substantial collaboration between the sheriff's team, facilities and contractors, Emmerich Construction, Carlson Vite, and Day CPM has been a game changer in getting this project to full fruition. We're on target, we're on budget, we're on schedule. We've had some scope changes due to just some changing needs as you get in there and you look at them, and if you have questions about those, Kevin can answer those and articulate those better. So the total funds proposed are $4,052,000. It includes $176,000 in small capital projects for technical equipment, including cameras, cell phone booster, and other information technology equipment. I'd be happy to entertain any questions you may have.
Questions or comments about those buildings? Seeing none, moving right along.
Nice.
It's good to see it get done. It's good to see it get done.
That is everything related to capital. So,
Thank you. No final
Mr. Chair,
questions. Yes, sir, Mr. Budget Officer.
what you have here, 3 of our 4 central service directors, Jane Veto, our legal counsel, is the other. They're doing a superb job. I think you will, if you talk to the department heads around the county, they really sing their praises, as do I.
And these folks and the council are really pivotal to everything everybody's doing at some point. They touch the lives of everybody in every department throughout the county and the inter-county relationships too. So yeah, I would echo that, John.
They're the hub of the Marion County.
Amen. Amen. So thank you all very much for your service.
Thank you.
Deliberations. Comments or suggestions or?
Well, Mr. Chair, I have a proposed budget note on the sobering center issue, so when I just hand it down, we could take a look at it. They're all the same.
You want to read that into the record?
So here, and again, this was just trying to get at the concept of what we talked about, and we can discuss whether or not a budget note is necessary. It says the county's $100,000 contribution towards creating a sobering center for the Salem area anticipates that the Marion County Health and Human Services Department will be consulted by City of Salem and Bridgeway Recovery Services in developing connections to county substance abuse and mental health treatment services. So it's just a request that there be consultation with the health department. My sense is Bridgeway Recovery Services has a pretty comprehensive set of services. They do mental health. They actually get Medicaid from Behavioral Care Network, and they get dollars from Marion County Parole and Probation also for doing their services. And they are primarily a substance abuse treatment provider, so they have those services as well. But I think that there will be crisis services that will be required, particularly a psychiatric crisis center that will need to be connected. And then my guess is that there will be some level of peer services or whatever, and I'm not sure whether Bridgeway is going to provide those themselves or whether they're going to look to the health department. But I think that all I'm asking is that there be tighter communication between the health department and the people that are planning the sobering center.
So if I'm hearing what you're saying is, as people come into this sobering center, it won't be just somebody who's so drunk they shouldn't be on the street, or so impaired by chemicals that they shouldn't be on the street, but it'll be somebody in crisis who will need care at some point during that 12 hours that they're there sobering up.
Or if they have a co-occurring mental health disorder.
Or co-occurring,
Right,
yeah.
then they're going to need, they could need crisis mental health
Yeah.
services, because we're open 24/7, and Bridgeway will probably not have a team available in the late evening hours. So, I mean, that was the original conversation that we had about this.
Yeah.
So,
Commissioner Cameron.
Mr. Chair, so just so I understand the sobering center, because this idea came to me, I think, 4 years ago about the need, because I did a ride-along with, which we don't have any control over, Marion County 1 Fire District, but I stayed overnight and went on a couple of calls and realized that there was no other option but for either a sheriff to take somebody to the jail or the ambulance to take them to Salem Health, period. And I think that now we've got the LEAD program out there that will help prevent those two options, because a police officer can meet somebody on the street that needs some help and make a decision at that point in time to get them voluntarily into those services. This will be another option for our sheriff to take somebody instead of to jail or instead of to the Salem Hospital. And so I think this is a real good program. I mean, obviously, there's going to be a lot of connections there. I don't know where this is in the budget. It's in the budget detailed. I asked John to see it. He showed it to me. So I don't know that, you're not asking, Commissioner, you're not asking to move where it is in the budget. You're just asking for somebody to be able to participate in the discussion so that the whole connection is there. Is that all you're requesting?
That's all I'm requesting. And
That somebody from the health department sits in on these discussions?
right, so that if there is a need for our services, we're not asked to do it at the tail end of the conversation, but as the proposal is developing.
Thank you. So the other comment I would make is that if this is the city of Salem they're asking us for a contribution. The city of Salem driving this, as well as Salem Health, I believe, is probably going to put substantial dollars into this. So we don't have total control over their discussions and what they want to do, other than this first $100,000 contribution, because we're not committing to an ongoing contribution to this. Would that be accurate? From staff standpoint, we've not committed to fund this ongoing?
That will be up to future budget committees, Mr. Chair, but I would bet that we will be committed for several years.
Okay, thank you.
And the purpose of having it as a budget note means it will come up for discussion with this question as we move forward?
Right.
And that's your intent? Yeah.
Right, I just
Yeah.
want to know kind of where the health department's involved, what our obligation is,
Yeah.
other than just handing them $100,000.
Yeah.
That's all.
And just follow up, so have they not been involved at all? They've not been in any discussions from Marion County?
I know that they were involved initially in putting the budget together, but I think it's been a fairly small group of people that has been involved since the original discussions. I think the only
Okay.
person from Marion County that's really been at the table is John, is that correct?
Troy Clausen has been involved.
Troy, that's right, Troy has been involved also. And he got involved really at our insistence, I think, because he had chaired a work group on a sobering center for, I can't remember, 5 years or something like that. And then those dots weren't being connected very well, so. I just want, also, I found a document that summarizes the statute, and it says a sobering center means a facility that meets all of the following criteria. The facility operates for the purpose of providing to individuals who are acutely intoxicated a safe, clean, and supervised environment until individuals are no longer acutely intoxicated. The facility contracts with or is affiliated with a treatment program or a provider approved by the authorities. They have to be approved by the Oregon Health Authority to provide addiction treatment. And the contractor affiliation agreement includes, but is not limited to, case consultation, training, and advice, and a plan for making referrals to addiction treatment. The facility, in consultation with the addiction treatment program or provider, has adopted comprehensive written policies and procedures incorporating best practices for the safety of intoxicated individuals, employees, volunteers, and the facility has to be registered by the Oregon Health Authority. And then once registered, then they will not be held, staff will not be held criminally or civilly liable for actions as long as they're doing these things on good faith, et cetera. And then the other thing that we talked about earlier with the 5 beds, because we did some research on this, health department did research, Eugene has 18 beds, Grants Pass has 12 beds, Klamath Falls has 8 beds. So this is why 5 beds to me seems like, I mean, it's a nice start, but I think they're going to be full every night. And then the question is, what do they do with the overflow? How do they make sure that they don't have the same 5 people taking up those beds night after night after night? So that's the concerns. So I'm going to move my budget note and see where it goes.
You will remove it?
I will move it.
Oh, move it, yes.
Yeah, I'm
Okay.
moving it.
Any objection?
Well, you need a second.
All those in favor? Oh,
I'll second it.
okay, Commissioner Krause. Okay, any further discussion? To include this as a budget note for discussion in the future. All in favor say aye.
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 Anyone opposed? Hearing none, the motion carries. Mr. White, it's up to you. Okay, any other?
No.
That's it? Oh, boy, oh boy, I tell you what. Comprehensive and thorough presentations and sufficient detail so everybody has a basic understanding and opportunity for anybody who wanted to comment. I have just one more, Mr. Budget Officer.
Well, at times in the past, we've done a recap, but I think that's probably not necessary this time. The Budget Committee's been very attentive, and I think it's been a thorough discussion of the budget. So I think this would be a time for anything the Budget Committee wants to talk about.
Comment?
Comment on the budget.
I have one comment, and I think I try to make it every year, and that is in the first section of the budget book, there's a timeline that talks about the target dates for various activities that you establish for staff and department heads and analysts and accountants to each do their inputs to make this possible. And that starts tomorrow, essentially, and will run all the way through. I'm sorry? Between now and sundown. But it really does represent, I mean, this is a tremendous amount of work that we recap in 12 or 14 hours of activity here, 12 hours here. And I just want to reiterate something that's been said. This stuff starts with, I think, every staff member at every level throughout the county and contractors and potential participants and so on all have a little hand in how this stuff all aggregates into these decisions. So special thanks to them, because it's become a very detailed, very readable, very easily understood process. At least everything here is transparent, and we're back to transparency again. It's there and it's visible and it's understandable to not necessarily somebody who's a Gatsby expert, but people on the street like me and my neighbors. So I want to thank everybody that had a hand in that. The next item on the agenda then is to adopt the motions. Oh, I'm sorry, yes, please.
Well, can I make a comment? First of all, I want to thank the Budget Committee for your service and the time that you spend with us. I think having citizen members meet with us just gives us a great perspective, and I know that these are long days to put in, so I appreciate that. Secondly, I want to thank, obviously, our budget team, and John talked about who they were at the beginning, so I won't name everyone. I see most of them sitting here, but there are a lot of people, as I mentioned in that column behind the scenes. Every department has a budget team that has to figure out what their budget's going to be, put the information in, then it gets reviewed, then they have to revise it based on the review and all of that. So there's just people across the county in all the departments working on this very hard. So appreciate that. I also this is my last budget, and I just want to thank particularly Jan, I'm just going to call her out, because I kept going in to see her and saying, hey, I've got this one little thing. I came in to her on the very, very last day when we found out WVCH wasn't going to do transformation grants anymore on an issue that we had for family checkup, I think it was, that there were some dollars that got put into the budget for that. So it is not lost on me that this budget includes a whole lot of initiatives that are near and dear to my heart, and Jan, as usual, made that possible by her scathingly brilliant, creative ways of working with the budget, and appreciate John being willing to entertain
Most of that
Jan's
was
ideas.
taking my arm and
I know.
twisting it up behind my back.
Yeah, I know. So, and for John for going along with it, I appreciate that as well. They're not just for me; they're for Marion County. I mean, LEAD, and we've heard the value of that program, law enforcement assisted diversion, the network of care that's going to be a resource directory countywide for people that want to know what the services are. Family checkup, which is helping families that have kids that are hard to manage. I mean, I think all of us have been approached. And I know when I walked door to door as for state rep, my first campaign back in late 99 and 2000, probably one of the themes I heard from people walking over in East Salem was, so what do I do with my child? You know, and Faye Fagel talked about that too in the juvenile department. My child's acting up, would you please arrest my child so they can get services? You know, and that's not, number one, that's not optimum. We don't want to do that. Number two, we don't do prevention services in the juvenile department. We wait till kids are arrested. So family checkup provides a evidence-based method for helping parents learn how to better relate to their kids and have them work together and be positive. So there's just so many things that Marion County does. Then certainly I have these scathingly brilliant ideas as well, but I'm just the cheerleader. I don't actually do the services. It's the sheriff's office and the health department and community services and our nonprofit partners and all of them that make these things work. So it's been just a great honor to be able to be part of this fabulous organization. So I just want to say thank you again.
Thanks, Commissioner.
And thank you.
Comments, Dave?
Actually, a couple comments and one question. You had indicated in the initial budget message about the Comcast revenues that would be coming in, and I'm assuming that those would be dealt with a supplemental budget once you finalize the number and then can make the appropriation based on the commissioner's decision of where it needs to go. Is that correct?
Yes, under budget law, if we know the money we're going to get, we have to budget for it under the budget law. We don't know. We don't know how it's going to work. And so it will be handled in a supplemental budget whenever we do know.
Okay. That was number one. Number two was, I was just thinking back on the past 8 to 10 years and the discussions at the Budget Committee level about facilities. And Courthouse Square was in demise and then in reprocess in reconstruction. After that, the health department had real facilities issues. The juvenile department had real facilities issues. The sheriff's office had space constraints. And it seems over the past 8 to 10 years that the staff and the Board of Commissioners have really paid attention to trying to upgrade the major county facilities and get them to a point where they're going to last for a 20 to 30 year period. And it seems like you're at the end of that process for major buildings, but you're also then taking the next step to deal with the infrastructure as far as IT and the needs of the departments so they can operate efficiently. And I think that that's a real compliment to the team that's been put together and the board for focusing on those issues.
I agree. Commissioner Cameron?
Well, I'm going to just echo all the comments that have been made. Staff just does a great job and makes this a very smooth and great process. And I want to thank all our department heads and the budget people in those departments that put in the time to make this thing happen. And it's just a real honor to have to serve in Marion County and to know that fiscally we're really solid and strong, and it's due to all the leaders that are sitting up here, the public leaders as well as the elected officials and staff. But it's great, and I want to say thank you, and I'm ready to have another year behind us. And Commissioner Carlson, I'm we are all going to miss you, but I knew there was all these things going on. And I kept saying, these are all going away presents, but you're right, they're not for you, they are for Marion County and all the leadership and things that you've done. It's been great. So looking forward to trying to figure out how to fill your shoes in the future. And no, I'm not doing grants. Somebody's going to do them.
Mr. Rentano.
I don't have too much to add. I know all the work that goes into it and the consistency. I heard Dave's comments and think we have addressed the physical needs. Although I look for little things, I never see where we demolish the old juvenile building. When do we do that? Was that in that budget?
It's on the list.
Oh, it's on the list. So a decision needs to be made, and I thought that right when I became a commissioner. That's 15 years ago, and it's still there. And I too appreciate Commissioner Carlson's contributions. I was wondering if I don't know if anybody else has even suggested a budget note under, in the 15 years I've been doing budgets, other than Commissioner Carlson. So maybe in the future, if you want to make one, you just call it a Carlson. Then that'll be clear.
Patty did too.
Patty did too.
It's former
I thought it was
legislators
you.
who do that. Watch
Right.
out.
Exactly.
Watch
Is that
out.
right?
Look out for next year.
Yeah.
Okay, fine.
So it's served on the Ways and Means Committee, so. Subcommittee.
Thank you, Mr. Rentano. Comments, suggestions?
You know, this is my second year on this committee, and I just walk away with amazement at the sheer enormity of the lives that are touched by what happens in this county. And I enjoy this process so much. I know that makes me a real nerd, but I look forward to this time where I can see all the things that are happening in the programs. I want to just really give credit to the foresight that occurs in this process of anticipating future needs, whether it's a capital need or just where our culture is going or where our community is going, and just really the attention to the community. And I've noticed this year just some positions that are in some of the key areas to have more of a strong community development. I think that's a great direction to go. So this is a really amazing experience, and I'm really privileged and thankful to be a part of it, and just the work that is done here. So thanks, you guys.
Thank you.
Make it easy for us.
Thank you all. One more piece of business, and that is approval of the tax rate. And if you would make that motion, please.
I move that the Marion County Budget Committee approve an ad valorem property tax rate of $3.0252 per $1,000 of assessed value for fiscal year 2018-2019.
You've heard the motion. Is there a second?
I would be glad to second.
Mr. Brentano, thank you. All those in favor say aye.
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 Anyone
Aye.
opposed? Hearing none, the motion carries. Thank you.
And if I could just comment on that one, has
Yes,
this
ma'am.
tax rate ever
She just
changed
did
in the
tax
16
rate,
years
so-
I've been a commissioner? No. So
just did-
this is the same tax rate.
Yes. Yes. For the record, that's a good point.
Right.
The
Just wanna
second
make sure
motion
that
we
know
need
that.
then is approving the budget officer's budget as discussed.
Oh, I thought we were going to defer for another couple days before.
We're going to have another meeting, another hearing
Want to
tomorrow.
come back?
Right. I would move that the Marion County Budget Committee approve the fiscal year 2018-19 budget in the amount of $445,424,664 by fund as presented by the budget officer, and forward the fiscal year 2018-19 approved budget to the Marion County Board of Commissioners for final adoption.
Heard of the motion, is there a
Second.
second? Seconded. Is there further discussion? Hearing none. All those in favor say aye.
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 Anyone opposed? Hearing no opposition, the motion carries. Now, there's one more thing before we adjourn, and it falls to me as the chair, Commissioner Carlson, Member Carlson, because you get a souvenir.
I do.
Yes. So this is a Marion County Budget Committee Certificate of Appreciation is hereby granted to Janet Carlson for 16 years of invaluable service and contribution on the Marion County Budget Committee. And it's signed by all of us and, by all of us.
Well, thank you.
So thank you very much. Further business to come before the committee. Okay, I would remind you
I'll hang it in my
that
new
we
house of
are available at the request if the budget officer needs us or if the budget needs us. In the absence of a noticed meeting and call before then, we'll meet sometime in probably February for our mid-year meeting. So until then, thank you very much for everything, and we are adjourned.